All right. Good morning, everybody. Welcome back to week 2 of the EHS Academy. Let's get started. I hope you guys all had a great week, and hopefully everybody had some time to go through the asynchronous material from our week 1 content. And just to review our week 1 topics, we had risk management and insurance from Brian Evans. We had fire and life safety basics and occupational safety basics from Snehal Rana and his team. And so I know we went through a lot of content during the live virtual presentations last week. And we also put a lot of really good asynchronous content on the Canvas site. So the first 15 minutes of this session today are intended to be discussion, any questions, concerns you might have had about that asynchronous content. We've got both Brian Evans and Snehal Rana present here. And before we get started on any discussion or questions, I just wanted to mention that, as much as I would want to be in person with you all, because I do believe that a real strength of this course is being in person. We're trying to do our best with the virtual presentations and the asynchronous content. But if you guys haven't been paying attention, I notice that we have people around the country in different parts of the U.S. that are participating. If you haven't been paying attention, the national championship for the NCAA basketball tournament is being played here in Houston tonight. And so as much as I would want you on site in person, please be thankful that you're not here, because we are literally located across the street from NRG Stadium where the game is being played. And so all of us who work here in office here on a regular basis know that it is absolute chaos when events like this are being played. So I'm excited for the game, but I'm going to be watching it from the comfort of my home tonight. So anyways, let's get started here, guys. Week 2 of the EHS Academy. We're going to spend the first 15 minutes with Brian Evans and Snehal Rana. So I welcome you to put anything in the chat, or if you want to take yourself off of mute and chime in with any questions, concerns, or discussion items for risk management and insurance, occupational safety, or fire and life safety topics. No one had any questions or concerns about the content? Anything that you guys would like above and beyond what we've already provided to you? Certainly happy to provide any additional information. I've got Andrea raising her hand. Go ahead, Andrea.
Good morning. I did have a short question. I think someone mentioned that most of the workers' comp claims you get are from the psychiatric facility. Is that right?
That happens to be the case on our campus. We
Okay.
trend all of our accident and injury data from our entire population at risk, which is our employees, our students, and our medical residents. And each year, among the top 3 is patient on employee assaults.
Okay, that was my question, was why that was. Thank you.
Yeah, and specifically, that psych hospital represents 8% of our total population, but the injuries are 45% of our total injuries are from that 8% population.
Thank you so much.
Yep, sure. And just to put that into context, so you don't think we're wildly unsafe in this particular setting, just to put this into context, we are operating the largest inpatient psych facility in the entire country. And those accident and injury numbers are vastly better than they have been in the past, despite the growth in the total number of inpatient beds over the course of time. We've driven those numbers way down, but it is a extremely high risk environment. And so we're always looking to improve. And that's actually why we have 2 full-time safety professionals stationed at that facility as well.
Gotcha.
And just another thing to add on there, half of the patients are court ordered to be there, which means they don't want to be there, basically. The other half are people that are having issues and need to be there. So it's just a real unpredictable environment.
What facility is it?
It's called the Harris County Psychiatric Hospital.
Oh, okay. That answers my question. Thank you.
It certainly raises an eyebrow for some people when they initially hear that without putting it into context. It's like, what the heck's going on over there at UT Health Houston?
Yeah.
But it is a unique environment. without a doubt. If you don't mind me just adding on to that, because the behavioral healthcare services across our country are expanding, they're being well funded. There are many facilities and programs being implemented across the country. We're getting a lot of questions about how we safely manage our operations at that facility. And so we are looking to expand our professional development opportunities for the behavioral health setting specifically for health and safety professionals. So we haven't unveiled this yet, but it is something we are working on currently. In the meantime, if you have a psych facility, inpatient or outpatient, and you're looking for any guidance, you can hit us up offline. I welcome you to contact us. Any other questions or discussion for Brian or Snehal?
I know we didn't get a chance to hit some of the occupational forklift and fire alarm emergency response. And that was all asynchronous training that we'd left for you guys. Did anyone have any questions or something they'd like to share from their institution? One of the things that we discovered this past weekend, even though we have a fairly good program as far as maintaining our contractors, but one of our in-house contractors decided they were going to do some painting on a stairwell. So I could try to share this picture with you guys, but so what they did was, this was discovered Friday, as a matter of fact. So what they had done was place a bucket on one of the stairwells, and then they placed the ladder on top of the bucket and on top of the stair, and they were proceeding to do some work apparently. One of our guys actually caught this, and they took a quick picture of this. Apparently the painter was kind of scared, but unfortunately these things do happen when someone's not observing what they're doing or checking them or asking them, hey, does this seem like a good idea? Again, if you got any questions, please feel free to ask us.
So we talked about this a little bit in part one of our EHS Academy in terms of, EHS's role in these types of situations. How do you most appropriately address a scenario like that? I mean, immediate stop work makes sense. And so intervening right away is important, but doing it in a way that is non-adversarial, as diplomatic as possible. You have to use your own judgments, whether it's immediately dangerous to life and health and you're putting the brakes on within seconds, or if this is something that you need to go speak with the contractor or their supervisors. These are all somewhat judgment calls on our part, but rarely do you get taught throughout your education or safety training about what is the best way to approach those scenarios. And so each institution is a little bit different. In our particular case, we work directly with the contractors up front before these projects even get started. When we catch things like this, then we work directly with those personnel and the supervisors on site to make sure that we prevent any accidents and injuries. We stop that work and we put in the corrective actions before we restart that project. Good catch, Snehal and team. Well, if there's no other questions or discussion points, oh, there we go. Wow, great. I don't know what's wrong with that picture, Snehal. You don't have to be a safety professional to figure that one out, do you?
Yeah, so this is what one of the guys had caught, but apparently the painter was crawling up on this and trying to paint. So sometimes these things go unchecked, and we try to mitigate it before it happens. And I'm sure you guys have contractors and even in-house personnel or facilities doing these similar things that, when you're not looking or on a weekend or after hours, they're doing these things. So we try to put a program in place to teach them those good practices and habits and simply common sense.
Well, since we just have another minute, I will mention, I don't know if any of you watched any TV this weekend. I had very little time to watch TV, but I happened to sit down last night and I caught just a few moments of the program on CNN called Fareed Zakaria. He's the news reporter, journalist, and he's got his little time slot on the weekends. And he was showcasing and featuring Admiral Bill McRaven on his show. And Admiral McRaven is the former UT System chancellor. So he's no longer our chancellor, but during his time, he used to give a lot of talks about understanding risk and managing risk. And he talked about this in the program yesterday on Fareed Zakaria. And I thought he did a great job. Whether you watch the show or not, I would encourage you to Google that one up and watch what he had to say. He just did a really nice job of articulating that it's important, whether it's in your personal life, whether it's in your your career, in the workplace, in order to make progress, you do have to take some risks. But it's always very important to understand those risks, to measure those risks, and to implement appropriate controls for those risks. And so it's just very compelling the way that he articulates it, much better than I. It was just really neat to see him online last night on Fareed Zakaria. So anyways, if you have a few moments, you want to Google that one up, I certainly would encourage it. Okay. Brian Snehal, thank you very much for your time. Both Brian and Snehal will be available in case any other questions or concerns come up. You can put them in the discussion on the Canvas site, and we'll get some responses back to you guys. Guys, thank you very much. We're going to move onward with our curriculum for week 2. So let's just talk about what we're going to do over the next couple of hours together. We're going to start out with chemical safety basics. We'll take a break, and then we'll have Dr. Brett Perkison, who's one of our occupational health physicians here on campus. He's going to cover our occupational health programs. And then we'll complete the day talking about hazardous waste management basics. And so if you reflect upon week 1 and our topics, it was intentional the way that we scheduled this. It's always important for the EHS Academy for us to lead in with these topics on week 1 or the front end of the training. Risk management and insurance, the fire and life safety, the occupational safety basics. Those are all core, really important concepts and topics for just about any setting, any work setting. I know most of us are in academia who are participating in this course, and that's the focus that we put on the EHS Academy. But really, those core topics are pretty universal in terms of their applicability in any workplace, any industry. Now, these topics in week 2 and week 3, for that matter, we are getting a little bit more granular. So the topics related to chemical safety, hazardous waste management, et cetera. Yes, there is some universal things that we're going to be talking about that are applicable outside of academia and outside of our laboratory and clinic settings. But we're getting a lot more focused in our topics during week 2. So I'm going to kick this over to Dr. Will Bryan and his team. Will, please introduce yourself. Tell us about your background so that our participants get to know a little bit more about you. And then we've got some really good live virtual presentation material for chemical safety basics as well. There's some good asynchronous material on the Canvas site for you for chemical safety as well. So Will, thanks so much for your time. I'm going to kick this over to you.
Morning, Scott. Morning, everyone. Happy Monday. So before I got into safety, I was basically a nanoparticle scientist doing research on basically nanoengineering of all things nanoparticle related. I did that for several years, and not really sure how I got into safety. I think it was more stable as far as job wise, and it definitely paid more than being a researcher. So I think that's how I eventually got moved over, and I'm glad that I did. And fortunately, we still get to do research. We don't do research as much on nanoparticles, and well, actually we do. We do research with the animal care facilities, nanoparticle research with animal dander and so forth, measuring the indoor air quality with animals, and so we do still do some. I still do some nanoparticle research and things like that. So that's kind of where we're at, yeah, it's been a fun ride. So hopefully you guys will learn something about chemical safety. And I guess I'm going to go ahead and pull the slides up here, Scott, and get started Welcome everyone to Chemical Safety Basics Part 1. And more specifically, I'll be talking about the Chemical Safety Program. And unfortunately, not a lot of universities, not a lot of companies have a specific chemical safety program. I'm sure if you've been in the safety world, especially in academia, you'll notice that a lot of places, they underestimate the role of chemical safety, and so hopefully we can change that, and hopefully you guys will learn, something about if you don't have a chemical safety program, hopefully you'll be able to set up a chemical safety program. And if you guys already have a specific chemical safety program, hopefully you'll learn a little bit about maybe we'll give you some ideas on what you can add or take out, or how to sell that program a little better. And I think Bob and Scott, they actually go into selling a safety program on one of these talks, I believe. So let's go ahead and get started. And so I'll be talking about chemical safety programs, and Dr. Manangdo, he'll start off with part 2 of chemical safety, speaking more about industrial hygiene and monitoring, etc. So first off, why is chemical safety important? Okay, that's pretty easy to see for a variety of reasons. Over 30 million American workers are exposed to hazardous chemicals in their workplaces. That's equivalent to about 1 out of 5 workers. Okay, approximately 20,000 cancer deaths and 40,000 new cancer cases of cancer each year in the U.S. are attributable to occupational chemical exposure. So this is kind of, I'm sure probably browsing the internet, you guys have seen these pictures. This is kind of early 1900s, before OSHA came along. That looks pretty scary. I don't know that I could have worked in that environment. Full disclosure though, I think I read somewhere about this photograph. There's actually a platform and you can see it below there. So technically, if these guys fell, I think they would have hit a platform, but nonetheless, it still looks pretty spooky. These guys are much braver than I would be. So fast forward after OSHA in the 1970s, we have lanyards, we have scaffolding, we have, to listen to some workers, more safety than you need a lot of times. I don't know if that's possible, maybe, but definitely, if you're working in these types of situations, more safety is better. There's been some notable events throughout history. 1971 was actually when the Occupational Safety and Health Administration was established. The number of workers killed went from 14,000 to 4,000 in 2009. So, what do we have? A population of 350 million, I believe, roughly. So yeah, that's not a lot in the grand scheme of things, but if you have a relative that's died from an industrial accident, then that certainly is a significant number to you. 1972, OSHA develops an issues first standard for asbestos. 1974, 14 carcinogen standard. 1980, right to access worker medical and exposure records. 81, the hearing conservation standard. And lo and behold, 1983, the HAZCOM standard, which we'll talk about that briefly here in just a second. 1987 benzene standard. Surprised that took so long. 1994, the fall protection standard. 2006, I'm sure everyone's heard or maybe even seen the Aaron Brockovich movie. And that was specifically dealing with the hexavalent chromium issue where the soil was contaminated and a lot of people developed cancer and so forth. There's also been some other early warnings throughout history, that it's taken society, several years to, actually heed these warnings, such as, fisheries, the mercury in fish, right? I'm sure a lot of you, if you're health nuts like my wife is, when you go to the store, you're always looking for the fish with the lowest mercury content, and usually that's those smaller fish, I believe. But all fish are contaminated with some amounts of mercury. Radiation. There's obviously when we were developing X-rays and whatnot, the famous scientist Mary Curie, she was exposed to radiation. There's benzene, hence the 1987 benzene standard, but there's trace amounts of benzene in your gas, right? My kids, when we get gasoline at the store, they can smell the fumes and they're always, oh, I love the smell of these gas fumes. And, they do contain trace amounts of benzene in the gasoline. So probably not a good idea to let your kids sniff the gas fumes. Bisphenol A, I'm sure you guys, if you are parents and you've had a few children, here recently there's been the issue of bisphenol A in the baby bottles. This has created a lot of concern, even for my wife and me. I'm a chemist by trade, and I was a little concerned. You have a newborn baby, and you're concerned that the baby bottles are leaching out bisphenol A, and so you get kind of scared about that. And then of course the asbestos. There were, unfortunately, asbestos is still hanging around in the environment, right? Sure, on at your place of work or at the college that you work for, there's still a lot of times there's asbestos in the pipe insulation and in the tiles. And so lots of places have to have a specific group for asbestos. And unfortunately, they still use this asbestos for heat tiles and things like that. There was a big issue up in I believe it was Libby, Montana. I believe that town is correct. Basically, that's where they were mining all the asbestos in Libby, Montana. And this guy that owned the company, he eventually knew that the asbestos was harmful to these workers, but they persisted, and these workers were bringing home the asbestos to their children. The whole town was contaminated. The children got asbestosis. The workers died from asbestosis, and so it was a big deal. But we had early warnings of how hazardous the asbestos is, right? But it took us a while to heed those warnings. Other things like PCBs, polychlorinated biphenyls. These are found in hydraulic fluid, electric equipment, transformers, things like that. CFCs, I'm sure all of you guys have heard of the CFCs. destroying the ozone layer. Fortunately, I read a story here recently. The ozone layer seems to be recovering in certain areas. I don't know, who to believe these days. It just depends on which article you're reading that day, whether to know if it's actually healing itself or not. Let's see, TBT, tributylin. Paints. These are paints on ocean liners and boats. Apparently, they were contaminating the oyster population in certain areas. Sulfur dioxides, that's been around for a while, and refineries, coal refineries specifically, and that creates acid rain and the like. Tetraethyl lead. This was an interesting one. That's basically a substitute for, well, tetraethyl lead was basically it's a lead compound, and they used to add it to gasoline. I'm sure if you get, some of you guys are old enough to know, you used to have leaded gasoline, hence the term unleaded, leaded. There was an interesting story. The scientist, PhD scientist Claire Patterson, who some regard as kind of the modern day father of industrial hygiene, was basically a lead scientist, and he was working at Caltech studying lead. And okay, comment: PCBs found in window caulking. Yeah. Yeah, I'm hoping they're not found as much lately, but I'm sure just like asbestos, depending on where this sources come from, you still have these contaminations. So back to Claire Patterson. He was again a researcher at Caltech, a lead scientist basically, and he was studying the basically the age of the earth and whatnot, but his samples kept getting contaminated, and so he couldn't find out or understand why his measurements were coming out wrong. So he set up a clean room, a clean lab, and he's, some regard him as the basically the father of setting up clean rooms. If you've been at a university long enough, there's clean rooms. If you work in the computer chip manufacturing, everything has to be super clean, can't have any contamination. Well, this guy, because his measurements were coming out wrong, set up basically a clean room, and to try and figure out why his measurements were coming out wrong. And so it was well known, or it was known that lead was hazardous at this time. This is around the 40s, I believe. To make a long story short, there was this other guy named Robert Kehoe. He was an MD, medical doctor that was hired by GM, General Motors, to basically research the health hazards of tetraethyl lead. And so, again, to make the long story short, these two guys kind of got into a battle of, this guy Kehoe from GM was saying, oh, lead in gasoline is not a big deal. My measurements are coming out fine. There's no concern with the lead. This Claire Patterson was saying, no, you're basically calibrating your instruments wrong. And basically what we have is a global contamination of lead. So this lead, again, he was working on the age of the earth at the time. So basically, he was saying that this lead is everywhere. It's in our food, it's in the air. It's contaminating everything. It's contaminating my lab, but they wouldn't believe him. it took several years for them to finally say, hey, this Claire Patterson is actually correct. And and uh, and so they finally developed lead standards and finally realized that, hey, Claire Patterson was right. This stuff is contaminating everything. The levels are much higher than we thought they were. And so, uh, you know, small win for the PhD scientist. And but if someone talks about Claire Patterson, most don't even know Claire Patterson. I didn't even know Claire Patterson, but he really did do a lot of work. And coincidentally, this Kehoe guy who kept saying no, it's fine, nothing. There's no concern here. This guy gets buildings named after him, but this poor Claire Patterson, I think he's relatively forgotten. So I guess that's how it is sometimes. Okay, so I got to move on real quick here. So there's some other concerns, hormones in milk. You see the label when you buy a jug of milk at the store. This milk is not created with hormones, and now the issue is, well, what about vaccines? Now that's going to be the future concern. Well, what vaccines are we being contaminated with? So that's going to be a future issue we'll probably see in the future. And mad cow disease, I'm sure you guys have heard of that. That's basically when they were recycling the slaughtered animals for animal food. Yeah, well, this was kind of a side slide. The question was wondering if the slides are working. They are working. I can send you guys this early warning slide. It's just a list of early warnings. I'll put that in the notes so you guys can access that. Mad cow disease, prions and so forth. So that was an issue, and I don't know if you guys have worked or heard about prions, but these things are proteins that are kind of scary. That once they get in your head and your body, it's really hard to get rid of these things. You really can't, and unfortunately, you don't even know you're exposed until years later. So that's a scary thing. The talking about new concerns are nanoparticles. I spoke a little bit about nanoparticles. These are going to be concern, if not already, in certain materials that we use. For example, the sunscreen. I see kids and my own kids. That my wife is spraying the suntan spray. They have it in a spray now, and so they're spraying all this suntan lotion on the kids. And some of these things have titanium nanoparticles, zinc oxide nanoparticles in them. So I don't want to freak everyone out, but if it's not air that you're breathing, you don't want to breathe it unless it's natural air. Yes, we have contamination. I live in near Houston, so we breathe in some contaminated air. But if you can avoid breathing in air that's contaminated with chemicals, then that's probably a good idea to do that. And so unfortunately, a lot of these products have nanoparticles in them. Like I said, zinc oxide nanoparticles, the graphite composite materials with carbon nanotubes. That's a big popular thing. The fear with these carbon nanotubes is, are these things going to be like asbestos? Because they're fibers, and depending on the size and the aspect ratio, meaning the width to the length, it can be hard for your body to remove these things, just like with asbestos. So is that going to be a new concern? I hope not, but at this stage of the game, we should be, we should be thinking about as a society, are these things going to cause damage to us down the road?
Hey, Will, sorry to interrupt. This is
Yeah.
Scott here. So just going back to that chat that you just received. So we are still just seeing the OSHA notable events slide. And I don't know if you've been toggling through other slides here, but
No. Here, do you see
Okay.
the new one?
Yep, there we go. Perfect.
Yeah.
Okay, very good.
But no, I was
just wanted to make
telling
sure.
them- Yeah, I was telling them there's a set of like 2 slides that I had a list of early warnings, and I added that in, late in the game this morning, just to give them a little extra stuff. But I'll put that so they can have that as well.
Very good. Proceed. Thanks.
Okay, I'll get off the toxic warnings and move on with the talk here. So, a lot of these companies have been penalized, rightly so. And here's a specific penalty for personal protective equipment. This AMD industry, these guys manufacture computer chips. And so they were cited as for a failure to provide proper training, protective clothing, and equipment to workers. Almost $1 million there for 15 citations. 4 willful citations were issued for failure to inform workers of the location and quantity of the asbestos, monitoring asbestos, and the use of appropriate vacuums and methods to control the dust, and etc. 8 serious citations were issued for failure to implement a respirator protection program and engineering controls. So they do actually, issue penalties to these companies, fortunately, for these issues. I don't know, not to get into politics here, but whether you agree on big government or small government, you can probably agree that sometimes these companies will try to get away with anything they can if they can make some extra money. I think we can all agree that some type of structure is needed oftentimes for these companies. Another one, this PJ trailer manufacturing company. They were cited for failure to provide fall protection, failure to provide eye protection, and failure to prevent exposure to welding fumes. Okay, so again, that's a significant fine there. Not providing the PPE for your workers. Okay, let's get to the elements of a chemical safety program. So like I said, sometimes chemical safety at a university or even at a company is underestimated, but really, it should be at the forefront of any safety program because it entails quite a bit. So we have hazard communication, basically the HazCom standard. And if you have chemicals and they're hazardous, you need HazCom, and you also need a chemical protocol evaluation, right? Once you determine that you have hazardous chemicals, you need to evaluate the hazards of these chemicals. You need a way to surveil the hazards, right? Some type of inspection to make sure, folks are, doing what they're supposed to do, work with these chemicals like they're supposed to work with them, etc. You need some type of occupational monitoring to make sure that you don't have any contamination with these chemicals, and always in some type of an emergency response program. Okay, accidents. If I'm a chemist by trade, again, no matter how long you work with chemicals, how safe you are, it's kind of like like a herpetologist, right? Working with snakes. No matter how safe they are, usually they get bit eventually. So you need some type of emergency response program. Okay, so let's talk briefly about HazCom. I'm sure most of you guys have heard about HazCom. Let me check my time here. Okay, I'm done in 15 minutes, so I'm running behind here pretty much. So I'm gonna pick up the pace a bit. So just chime in, guys, if you have a question. So one of the main key points of hazard communication program is, especially if you have a lab, right? You have chemicals, you may have a lab, usually you have some type of lab, and that's dealing with the OSHA laboratory standard, 29 CFR 1910-1450. And the key point with this standard is the chemical hygiene plan. Okay, this is the most important part of that standard, and it has to be readily accessible. Okay, the plan should include the responsibilities of all parties, the standard operating procedures for the chemicals. How do you control these chemical exposures via engineering controls, administrative controls, etc. What to do if someone's exposed, having a chemical hygiene officer on hand, and any other special provisions for chemical use. The most important thing with the chemical hygiene plan is that if you have, which you should, if you have chemicals, if you have a chemical hygiene plan, whatever you put in this chemical hygiene plan, you have to follow. Okay, that's the most important part. If an accident happens and someone is investigated, they're going to look at your chemical hygiene plan. And if you say, hey, we're going to train these workers on this chemical this number of times, you have to have followed that. If you don't follow that, then that's where citation or further issues could occur. Okay, why train? That's pretty obvious. Who should be trained? Anyone working with the chemicals, basically. When should training occur? Usually, your HazCom training should occur, right when the worker starts or right when the worker is assigned a new type of procedure, a new exposure situation, etc. Right? It's pretty common sense. If they're working with something new, then obviously they need to understand the hazards. Obviously, in the chemical hygiene plan, safety data sheets, those are one of the most important things. Main thing with the safety data sheets, and I'm skipping ahead, but they have to be accessible, right? Like in the old days, we would have paper copies and a big binder of chemical safety data sheets. But nowadays everyone does it usually electronically. And so the main thing with the safety data sheet is it has to be readily accessible, right? And if you have any non-English speakers, then you have to have access to a safety data sheet that they can read and understand, right? Do I have to train on specific chemicals? No, but that's not really being safe, right? If you just train someone generally, then that may not address the hazards of that specific chemical. And I know specifically at a university, it's hard to train everyone specifically on their specific hazards, but the lab should follow up with that specific training. Let me jump ahead. This is kind of basic stuff that you guys probably, I'm guessing, if you've been in safety any length of time, you probably have seen this and know this. So I'm gonna skip ahead real quick. Any laboratory that produces a chemical for another user outside the laboratory must follow the requirements of 1910, 1200, produce an SDS. So, you know, again, talking about universities here, but if you get a chemical from another university that they've produced, technically they should have some type of safety data sheet and labeling requirement for that chemical, right? I know a lot of universities, they just, pack it in their car, drive it on over to the neighboring university, and all is good. But technically, you should have some type of safety data sheet. Back on the safety data sheets, again, I've seen several instances where someone's inspected by OSHA or by a risk management entity, and they always, hit the safety data sheets, and usually they go around and say, where are your safety data sheets? Do you even know what a safety data sheet is, and can you access them? And surprisingly, a lot of times, especially like with facility workers or someone that's not really working with chemicals on a consistent basis, they oftentimes don't even know what a safety data sheet is. So that's important and key to make sure all the workers are trained and not to leave anyone behind. Okay. Again, this is just more about safety data sheet. Okay, so into the chemical protocol review. So the workers are trained. We've found that there are chemical hazards and there are specific chemicals being used. Well, to have a good chemical safety program, you need to have some way of reviewing these specific chemicals and these specific procedures. And the way we do it here is we specifically have a chemical safety program, and more specifically, we have a chemical safety committee. And so that kind of drives the compliance for most of the researchers to review their chemicals and make sure they have the appropriate measurements in place to prevent any accidents. So there's various ways we can identify who has these chemicals, and that's through purchasing systems, grants, animal care, waste collection, all these ways. It would be great in a perfect world where the researchers would send you an email and say, hey, I'm using this hazardous chemical that I really think you guys should review and make sure we're being safe. But, we don't live in an ideal world, and that usually doesn't happen. So we have to use other means to make sure we're getting all the hazardous chemicals that come on to the facilities. In our chemical safety committee, okay, we don't review every chemical, right? If you go to most researchers and you say, I want to review, and you need to fill out this protocol for dichloromethane, which is a solvent that every researcher uses, they're going to look at you kind of like you're wasting their time, you're stupid, and why do I need to do this, etc. So the way we've countered this is we don't review every chemical, but we have a specific selection criteria for certain chemicals that are hazardous. Okay, so again, we don't review all the chemicals on campus. We just review a certain selection of chemicals that fit a certain criteria. Our criteria here is, are they carcinogens? Are they highly toxic? Are they nanomaterials? Are they explosive? Are they pyrophoric? Are they a poison gas? Are they anti-neoplastic? Are they pesticides? Are they a select agent toxin? Okay, so that's our criteria for review. So if any chemical that comes on campus meets those criteria, then we send that chemical to a chemical safety committee with a certain protocol that we've reviewed, and we review those safety hazards and those issues that deal with that chemical. Okay, and we have several different people on our committees. These can be researchers that actually work with chemicals. It can be industrial hygienists, MDs, etc. Okay. Paracelsus, all substances are poisons. There's none which is not a poison. The right dose differentiates a poison. Okay, so it depends on, the amount, right? The dose. And usually, again, here's one specific criteria of toxicity. We usually do that by the LD50. Okay, so if it has an LD50 below a certain threshold, then we'll say, oh, this chemical is toxic, and we'll review it. And here's that chart there. Okay, so we have to have some type of inspection process, some type of surveillance process to show that these researchers, these workers are doing what they should be doing. And I'm sure most of you guys have obviously seen inspections, gone through inspections, etc. So I'll kind of speed up because I'm almost out of time here. This is pretty basic stuff. I would say on the hazardous waste, a lot of universities, a lot of companies, they like to store the hazardous waste outside of the fume hood, and that may be appropriate, but oftentimes it's best to actually store small amounts inside the fume hood, right? Obviously, you don't want several jugs of, hazardous waste in a fume hood, right? Because it disturbs the airflow, and then that causes turbulence. And so then the chemical fume hood is, insufficient. It doesn't work because the turbulence is blowing contaminated air out, etc. However, small amounts, in my opinion, should be in the fume hood. I can't tell you how many accidents I've seen and heard of, happening specifically with nitric acid and organic waste. Nitric acid, anytime you put it with organic waste, it's an explosion waiting to happen. Most of your explosives, nitrate explosives, are that. They're nitric acid with some type of organic chemical, nitroglycerin, nitrotoluene, etc. So in this case, it would be a good idea to have that nitric acid waste bottle or that organic waste bottle in the fume hood, right? Because it will explode, and I've seen that happen. So we've got okay, so I got about 3 minutes, so I got to wrap it up here. This is pretty standard stuff. One more thing with the fume hoods, it may be a good idea to go back to your place of work, your university, and make sure all the fume hoods are from 80 to 100 linear feet per minute. Some fume hoods are way higher than that. Anything over 150 linear feet per minute is no good. After that, studies have shown it creates too much turbulence and renders the hood ineffective. And I will say, we've had some universities where they run their fume hoods really high, but that wastes a lot of energy. And we've on campus here, we've actually reduced the flow of the fume hoods, not below 80, but we've reduced the flow of the fume hoods, made them consistent, and we've also put sensors on fume hoods, zone present sensors. That way, if you're not working at the hood reduces the flow. We have reduced the air changes in the labs down to, where they were maybe 8 air changes per hour. And it depends on the situation, reduce them down to 6 air changes per hour. If they're a training lab that doesn't really use chemicals, then we could reduce that even down to 4 air changes per hour, according to NFPA. That allows for that. So, point being, go to your university and let them know, hey, we could save a lot of money by reducing this airflow when it's really not needed in certain cases. That will save the university and the environment tons of money. Okay, PPE. I think everyone knows about PPE pretty much. And I'm going to go emergency response real quick. That's pretty self-explanatory. You got to have some way, if something happens, allowing for, spill cleanups, etc. So make sure you have that in your program. Make sure you fully understand PPE and the selections and your monitoring devices. Andrew's going to get into that a little later. I think these slides are pretty self-explanatory, and so I'm gonna switch it on over to Dr. Manongdo for the second part of industrial hygiene. Do look at the metrics here. At the end of the day, everyone has a boss, and you have to be able to tell your story, what good deeds you're doing at your place of work, right? You have to be able to say that, hey, we've surveilled this many labs, we've checked this many odor complaints, we've spilled this, or we've cleaned up this amount of spills. So you have to have some type of way to measure what you're doing. Okay. Okay. And I'm going to switch it on over to Dr. Manongdo. I hope he's on here.
Basic stuff. So I'm just going to continue on that. And I am going to talk about some basic concepts in industrial hygiene. Since we are from the Chemical Safety Committee, maybe the presentation is going to be a little bit biased towards what we do in the chemical safety team in terms of monitoring activities that we do in the university. Towards the end of the presentation, I will be showing a lot of the industrial hygiene equipment that we routinely use when carrying out our activities in our program. All right, so just a brief definition of what industrial hygiene is. So basically, there are 4 key concepts of industrial hygiene: anticipation, recognition, evaluation, and control. And just like anything with safety, our goal here is for our workers to be safe whenever they're in, for example, in the university or in the workplace. And we want them to be as comfortable as possible whenever they are in the workplace. So based on that definition, we can really see that, or we can say that industrial hygiene is really an integration between art and science. industrial hygiene, we use fundamental concepts of, let's say, chemistry, physics, biology, mathematics. So those are the scientific components. But on the other side, safety also involves a lot of. So what we do here in EHS at UT Health, we do a lot of support for the university community, whether it's the faculty, it's the staff, it's the students. So it involves a lot of soft skills that is not really related to science. So let's say communication. We do a lot of program development. We do a lot of training. So that is the artistic component of industrial hygiene. So it's really a mixture of both of them. All right, so I'm just going to go over the 4 key concepts of industrial hygiene. So the first one is the anticipation. So we should be able to identify or predict what kind of hazards we are expecting to find in the workplace. So we established that by performing job hazard analysis, establishment of safety committees. So we'll touch a little bit about what we do in the chemical safety program. And basically, we develop SOPs. We have a chemical hygiene plan. So those are basically what will happen if there's an emergency. We have something that is in place. So a lot of the trainings that we do in the university as well would be the HAZWOPER training. We do a lot of protocol chemical reviews and inventory management. Just in case that we're running out of stuff, we should be able to anticipate that we should get some more of those supplies. So the second one would be recognition. And recognition is identifying the hazards that are already existing in the workplace. So we do that by examining past incident reports or surveys. We review the current chemical inventory. So each month we do a lot of biochemical surveys and chemical surveys. And part of those inspections would be asking our faculty members to provide us with their most recent chemical inventory forms. And another thing that is important in recognizing hazards would be really communicating with the faculty, students, and staff, whether or not they have concerns. And a lot of the concerns that we usually get from our faculty, most especially, would be in their air quality concerns and odor complaints. Evaluation is next, which simply means that we have to make sure that the systems that we put in place are working, and we do that by conducting routine surveys or annual surveys, risk assessments from previous, by reviewing previous surveys. We should be able to identify what those hazards are already existing and what they are doing to our workers in the university. We also conduct program evaluations. Just this year, we've been doing a lot of improvements on our controlled substances program. And each week we do continuing education in the department. And part of those would be whether a safety specialist would provide a talk based on his or her own experience, or we do annual refreshers of the programs that we are already doing. And then finally, we are all familiar with the hierarchy of controls, and that is the last concept of industrial hygiene. So the bottom of your pyramid would be the most effective control methods we want to eliminate or substitute for the most part, elimination is a little bit hard because there's not really a substitute, or for example, in a chemical reaction, there's only one chemical that you could use in that particular process, and you can eliminate that. And at the same time, since that is the only substance that will work with the chemical reaction, a substitution would also be a little bit hard. But in terms of feasibility, substitution methods, although it's not as preferred as elimination, it is a little bit more feasible in the workplace. And then as we move up the pyramid, we have engineering controls. So the goal of engineering controls would be to isolate our workers from the hazards at the workplace, or occupational hazards. We do that by an example of engineering controls would be we use a lot of biosafety cabinets or HVAC systems, chemical fume hoods. So those are some examples of engineering controls. Although we can't really eliminate completely the hazards, but those engineering controls minimizes the exposures of the workers while they are performing their, let's say, experiments or whatever they're doing in the university. Next is if engineering controls sometimes they don't work as sometimes there are limitations for engineering controls, and there's actually good synergy with administrative controls. So whatever the engineering controls cannot catch, sometimes putting in place processes or changing the way that work is performed in the workplace really helps minimizing risks that hazards are giving in the workplace. And then finally, if your all of your controls, your elimination, substitution, engineering, and administrative controls would fail, our last resort would be giving our workers personal protective equipment. Obviously, this is least preferred, and probably we would say that this is also the least effective amongst the controls. But an example of that would be during the COVID-19 pandemic. We are all familiar with the N95 masks. Our respiratory protection program has been very busy for the past 2 years, giving trainings, both trainings and providing PPEs to our students, faculty, and staff. We can say that in a university, we are always going to find chemicals, whether it's in a chemistry lab, a biology lab, in a cafeteria. You're going to find chemicals in the bathroom. You're going to find chemicals. So chemicals is a universal occupational hazard in a university, and as an occupational hazard, we can define a chemical as any substance that can pose a real hazard to human health or the environment, whether or not it's it's due to the physical or chemical characteristics of a certain chemical. And it is important to point out that there is a huge difference between hazard and toxicity. Hazard is a potential source. It's not necessarily a chemical. So in this case, in the context of the chemical safety program, obviously I'm talking about chemical sources, but in a grand scheme of things, hazards are not necessarily a chemical. So for example, confined spaces is an example of a hazardous place for a worker, but it is not necessarily chemical in nature. while toxicity is the ability of a substance to produce an adverse effect in a biological system. So we see this a lot, not only with chemical substances, but biological substances as well. Another thing that I would like to point out would be occupational hazards are not always chemical in nature. We find a lot of occupational hazards that are biological. For example, in a biology lab, they use a lot of select agents or bacteria, virus, microorganisms. Physical hazards, an example of that would be radiation. Noise is an example also of a physical hazard. As well, noise is both a physical and an ergonomic hazard. And then finally, another example of an occupational hazard would be ergonomic hazard. So if you're doing activities routinely over and over again, then at some point your body is going to give in. An example of that would be carpal tunnel. All right, so for a chemical or for a hazard, a chemical hazard, to have an effect on the body, it has to be in contact with it. And there are four general occupational routes of entry for a chemical or a biological agent. So first would be skin absorption, so contact through skin. And it is also, before I continue, it is also important to emphasize here that being in contact with a certain chemical doesn't necessarily come with a job. So sometimes someone is just being careless, and sometimes it's really an accident. So skin absorption results from contact through skin or eye surface with a certain chemical substance. Second would be inhalation. We breathe in the chemical substance, so we're looking at very fine particles. Third would be ingestion. And ingestion is swallowing something by either drinking or eating. An example of an accidental ingestion would be if you are a smoker and you are in a lab, you're not wearing gloves, then suddenly you are in contact with a chemical substance. You go out to smoke, you touch the cigarette butt, and then that hazardous substance transfers from your dirty hand to the cigarette butt to your mouth. So that's an example of an accidental ingestion. And then finally, the last route of entry would be injection. Some sources refer to this as inoculation, and it results from penetration of, let's say, a needle through your skin. So there are several types of contaminants that are of concern in chemical hygiene. So the physical states would be gases. They could be gases, vapors, aerosols, dust, fibers, mist, fumes, and smoke. So I have described here the different characteristics of those different contaminants. So I'm just gonna go through a couple of these. So for example, an aerosol. So an aerosol is a suspended particle, whether it's a liquid or a gas, and it's suspended in air. So an example of that would be the respiratory droplets containing the COVID-19 virus. So these are very small particles ranging from the nanometer scale to the micron scale. Another interesting thing would be a mist. So a mist is a liquid particle suspended in air or gas. I'm not really sure. Do we have any chemists in the audience? Or do we have any science majors? So if you've played around in chemistry lab, you've seen concentrated sulfuric acid or concentrated hydrochloric acid. As soon as you open the bottle, you would see a cloud-like formation on the opening of the reagent bottle, and it's simply a mixture of your your gas molecules and the vapor of those organic acids. So in general, these are the contaminants that we look for or that we encounter on a more regular basis in chemical hygiene. All right, so other than the physical states of these contaminants, it is also important that we know a lot of their properties. So we've discussed the physical state. So I have an example here, chloroform and hydrogen sulfide. So one is a liquid and one is a gas. So if we go down through the different types of properties, we can see the primary difference in the numbers that we see, just because, and that is very relevant with the fact that one is a liquid and one is a gas. So we see that very clearly with the vapor pressure measurement. So hydrogen sulfide has a very high vapor pressure, which makes sense because it's a gas. However, if we look at the vapor pressure for chloroform, it's 160 millimeter of mercury. So just to give you an idea or a reference, so water has a vapor pressure of 760 millimeter mercury. So that indicates that a low vapor pressure means that the gas molecules can easily escape the surface of the gas, making chloroform a very volatile liquid. So volatile liquids in the workplace poses different types of hazards. So you have not only that it's an absorption hazard or ingestion hazard, the fact that it volatilizes makes it also an inhalation hazard. So another thing that I would like to point out here would be the property odor threshold. So chloroform has an odor threshold of 192 parts per million, and hydrogen sulfide has an odor threshold of 0.0005 parts per million. So what these numbers indicate is that you only need a very small amount of or a very, very low concentration of hydrogen sulfide for you to be able to smell that compound. So the odor threshold is an important property, particularly for hydrogen sulfide, which makes it an attractive additive to gasoline to give it a better warning property. So typically, if you have a volatile gas that has a very high odor threshold, that makes it a little bit more hazardous, since you don't know that you're already being exposed, or you've already been exposed to higher levels of that hazard before you can detect it by your senses. All right, so I'm gonna move on now to the different sampling strategies that we use in industrial hygiene. So again, the way that we structured this presentation is we're presenting to you the different activities that we do in the chemical safety program. So all of the instruments that you're going to see here in the presentation are, we actually have them here and we use them routinely. All right, so the goal of sampling, or the goal of any experiment, maybe in the context of a chemical safety program, would be first, we want to identify what the hazards are in the workplace. We want to assess, and then after we have done our risk assessment, we want to select a method. So these methods are, whether it's instrumental or a laboratory analysis, we should be able to measure our contaminants, and in that way we can also find out how much exposure each of us are being exposed to that particular contaminant or particular hazard. The fourth one would be to evaluate how. So basically, we want to validate our results. We want to make sure that we are not making things up. We want to be able to present our data in a way that we have high level of confidence. So we perform statistical analysis. We do statistical analysis, and we do interpretation of the results that we've had. And finally, what is the goal of those measurements is that we can enforce processes, or we can implement processes that could maybe minimize those hazards in the workplace. So sampling strategies, there are several factors that we have to consider when we are trying to find out what type of sampling or what type of method we are going to use. So first, what is the objective of the sampling? So is it for a certification process, or is it just for someone is complaining, or is it for regulatory compliance? So the scope of your sampling strategy will really depend on what kind of, or what is the reason, or what is the purpose of why you are sampling. So for example, if you are sampling for certification or regulatory compliance, you would want to sample with a higher degree of precision and accuracy. Second would be the scope. So this is again relevant to the objective. Qualitative versus quantitative. So quantitative indicates that we want to look at exact numbers. Qualitative, we are only trying to find out whether a hazard is present or not. So typically, qualitative analysis are shorter compared to quantitative analysis. Quantitative analysis, we usually do more steps after that. And what type of analysis or what type of sampling we want to do, whether is it a personal sampling or we want to sample the entire area. Another factor would be what are the techniques that we want to use. So again, it all goes back to the objectives and the scope. So if we want to use a quantitative analysis, or we want to perform a quantitative analysis, we would want to use instruments. Meanwhile, if we want just qualitative analysis, it could be as simple as using your own senses, or let's say using, let's say a pH strip. So a pH strip is, you can say that it's an instrument, but not in the same way that we think about as instruments like an IR spectrum, like an FTIR, or let's say a GCMS or a mass spec. And another factor under the techniques would be how precise or how accurate do we want our measurements. And the other two factors would be what are our references. So we are going to go through that in the succeeding slides. And other factors that we always want to consider when choosing a sampling strategy would be what is the cost and what is the turnover time. So do we want our results immediately, or it can wait another week? So overall, these are the things that we look at when picking a sampling strategy for our experiments. All right, so after, so we can really classify sampling techniques into two categories. One, with the use of direct reading instruments, and second would be what is the sampling collection method. So under sampling collection, it's either a passive sampling or an active sampling. And for the most part, whether it's a direct reading instrument or a passive or active sampling method, a lot of these sampling techniques would have to go to a laboratory, or we would have to submit samples to a laboratory, whether it's for validation or for complete analysis. So passive sampling relies on natural air movement. So an example of a passive sampler would be a badge. So different badges are suitable for different types of contaminants. These badges are typically placed in the clothing of a worker. So these are passive sampling can be a good method when you are doing personal sampling experiments. So main advantage of passive sampling techniques would be the cost of it, especially if your department doesn't really have an in-house laboratory. It's easier to send everything out in an accredited lab and have it analyzed there. But the primary disadvantage of passive sampling would be that it's very susceptible to interference. The detection range is quite limited, which means that you would have to sample a lot to be able to get a good result. And that goes to the limited accuracy and the detection limit. The second type of sampling would be active sampling. So unlike passive sampling that relies on the natural movement of air, active samplers uses a pump. So that pump actually moves air in your surroundings onto your sample collection tube, whether it's an absorbent tube or a filter or any other media. So it brings your contaminants from the air into your sample collection receptacle. The advantage of having a pump is it creates a consistent flow rate. So basically, that is one of the things that you can control during your sampling method. That reduces a possible error during collection method. However, a main disadvantage of active sampling methods would be that it could be time consuming and it requires more extensive training compared to passive sampling. And the third sampling technique would be the use of direct reading instruments. So from the name itself, direct reading, it gives you instantaneously a value. So let's say you want to measure noise level. So you would want to probably get a dosimeter, and a dosimeter would have a screen, and that screen gives a quantity of noise. So that is the main advantage of direct reading instruments, is that it gives you immediate results. Also, real-time monitoring is possible with direct reading instruments. They are highly sensitive and highly selective, but with that sensitivity and selectivity comes a disadvantage. Direct reading instruments can only be sensitive and selective if you have the right sensor or detector that that is installed in your reading instrument or equipment. And these detectors and sensors could be expensive sometimes, and they also require routine calibration and maintenance. So there's a lot of things that goes on when using a direct reading instruments. But for the most part, I find it fun using these direct reading instruments. It's like playing with a toy. Later on, I'm going to show you one of the most recent instruments that we have acquired in the department. So the picture here is an example of two workers that is sampling under a confined space. So they're likely measuring oxygen levels, making sure that you are not in an oxygen deficient environment. So I'm gonna go through some examples of direct reading instruments that we use in the department. So this one is a multi-ray. So the multi-ray that we currently have is a 5-sensor multi-gas meter. So the nice thing about this multi-gas meter is that it has an active sampler, so which means that it has a pump, and it gives you 5 different quantities all at the same time. So so in here, the screen here, this is the exact one that we have. So you have an oxygen sensor, you have a carbon dioxide, you have sulfur, hydrogen sulfide sensor, and a VOC sensor. So like what I mentioned earlier, each sensor type is useful for a specific type of contaminant, which means that the types of contaminants that you could measure at any given instrument is quite limited within those range of detectors and sensors. So another example of a direct reading instrument that we have here would be the mercury vapor analyzer. So we have the Jerome mercury vapor analyzer. And the principle behind this sampling technique is based on the phenomenon that gold films, thin films of gold, would undergo a significant change in a resistance. So basically what happens is if it gets in contact with a mercury vapor, the resistance will shoot up, and that increase in resistance is directly proportional to the absorbed mercury vapor or mercury mercury vapor. So this SEM image here is not really what happens in the Jerome, since the sampling technique, we don't spend too much time on it. So this SEM image is what happens when gold and mercury comes in contact. They form an amalgam, but this amalgamation process takes time, and sometimes it requires a little bit of higher temperature. All right, so this is the most current instrument that we have. We have a portable infrared analyzer, which is the GasMet. It's an FTIR, so basically it can measure up to 50 gases, inorganic or organic gases. It results into an IR spectra, which is basically a chemical fingerprint. It has a Peltier cooled detector, and it gives you a real-time measurement of different gases during your collection process. So it's around $60,000. Right, so this is just a schematic diagram. All right, so evaluation techniques so after your sampling, you undergo analysis, quality control, and then you expect a lab report if you submit it elsewhere. So under analysis, you want to select a proper method, and then you want to prepare your samples, and whether it's extraction or removal of interferences. You do a quality control. So I'm going to go through them real quick in the later slides. And then, the lab gives you a report afterwards. So this is a typical example of a NIOSH method. So this is the sampling method or analysis method for formaldehyde. One thing that I want to point out here would be the accuracy of the method. So you can see here that it's plus or minus 19%. So if you think about it, 19% is a very big error for an analytical method, but actually 19% is within the acceptable range of accuracy for an industrial hygiene method. All right, so during the calibration process, it is important that we always calibrate to make sure that we remove any errors that is associated to a sampling technique, whether it's a systematic error or some random error. It is essential to calibrate since it increases your accuracy and precision. Like what I said, OSHA sampling and analytical methods must be within 25% at the PEL or the permissible exposure limit, or plus 35% at half of the PEL. And these collection or the sampling methods or these methods, that 25% also includes an assumed 5% due to sample collection. So the quality control, so once you're done with your calibration and once you're done with your analysis to make sure that everything is fine or everything or your results are good, you want to make some kind of validation experiments, and that's what we call as a quality control. So a few ways of doing quality control would be performing field blanks or media blanks. But one of the best ways of performing a quality control would be using spiked samples. And spiked samples, we basically add a concentration or a sample with a known concentration to your sample, and you carry out your lab analysis. So this spiked sampling or analysis of spiked sample, you can think of it as a standard addition method if you're familiar with analytical chemistry. So one of the advantages of spiked samples would be that it removes matrix effects, since it reduces the effects of interferences in your solvent. So sources of error, there's not one method of analysis that is perfect. However, we can always strive into reducing those errors whenever we're doing our analysis. And I've listed here 5 different ways of how we can reduce that, or 5 ways by which our results are affected. So one would be sampling from your collection to the transportation of your sample from the field to the lab. Second would be evaluation. Did you calibrate your instruments right or not? Environmental parameters. So these are a little bit hard because the environment is constantly changing. So what you could do to reduce effects of environmental parameters, errors from environmental parameters, is try to sample as close to, let's say, the temperature of your sampling collection, and then you perform your analysis to that same or as close to that same temperature as possible. So analytical errors and sampling handling errors are, so these 5 are the different types of sources of errors in sampling or in analysis in industrial hygiene. Okay, so this is a typical example of a lab report. Couple of things that I want to emphasize here would be, in any lab report, you are going to see what type of method that is being used. So in this case, this is an EPA method. So the previous method that I showed earlier would be from a NIOSH method. But this EPA method is still within that 25% accuracy range that is required for an industrial hygiene method. And the second thing that I want to emphasize here, so that ends the sampling for industrial hygiene methods. The rest of the slide would be for noise and ventilation. You could read through them. So those are the few other things that we try to measure, or we try to monitor in the university. And if you guys have any questions, you can send an email or yeah. Sorry about that, Scott.
No problem. Andrew, great presentation. We're at our time point now for a short break. As mentioned, this presentation is going to be on the Canvas site, so you can go through this material on your own time. And there's a few more slides that you can certainly look at, but I apologize that we're running short on time here, so we're going to move forward to our break. It's now 10:49 Central Standard Time. We've got 11 minutes break time. We'll come back promptly at 11 a.m. and we'll get started with our occupational health section. Again, thank you very much to the chemical safety team for these presentations. And all of this information is up on our Canvas site. And if you have questions or discussion points about any of this material, you can put it within the Canvas site, and we'll be monitoring that closely. We'll sign off here for a 10-minute break. Thanks so much. All right, welcome back, everybody. I've got 11 a.m. Central Standard Time. Let's get moving forward with the second week of the EHS Academy. I hope you guys enjoyed the chemical safety basics section of the training. I'm very pleased to introduce Dr. Brett Perkison, who is going to cover our occupational health programs section as well. For the next 30 minutes, we can hear from Dr. Perkison on occupational health programs. I'm going to let Dr. Perkison share his slides and also spend a moment or two introducing himself and telling you a little bit about his background and experience. Dr. Perkison, thank you so much for your time. I know you're busy with teaching and clinical activities, so much appreciated.
Yeah, no, you're very welcome. Yeah, hello everyone. Nice to be joining you all. Here, excuse me, I'm here at the School of Public Health. My background is I'm a physician. Have done residencies in family medicine and occupational environmental medicine, and I'm currently the program director here at the School of Public Health for the occupational medicine program. And but after graduating, I've been in private industry. I was at Shell for 5 years in manufacturing and corporate environment, and so I have a lot of experience with that. Really, that relationship between occupational medicine, health and safety, industrial hygiene, and excuse me, I'm going to talk a little bit about that today. Just give me a moment and I'll share my slides here.
We saw your slides from, oh, they're coming back up. Perfect.
Okay, well, very good. So yeah, so I was having trouble with the audio there. So we're going to talk a little bit about what is occupational health and what does occupational health do. Yeah, I'm in this mode right now and I can't really see the chat or our hands posted, but otherwise I'd sort of ask questions back and forth a little bit. But hopefully some of you all have worked with occupational health departments, and if you haven't, I'm here to chat with you a little bit about why that's so important. So we'll start off with a definition. According to the World Health Organization, occupational health is defined as promotion and maintenance of the highest degree of both the physical, the mental, and social well-being of workers in all occupations. And if you think about it, that's a very holistic definition. And the trends towards occupational health being holistic has only increased over the years. Our School of Public Health offers the only PhD in the country on total worker health. And total worker health really discusses this about not only as we're looking at exposures and hazards at the workplace, but we're looking at how workers with chronic diseases, how that might affect them at the workplace. And you can kind of think about that, somebody with high blood pressure or uncontrolled diabetes, if that's not being adequately treated, then they run the risk that when they go to work, that is going to affect the safety of themselves, of others, and productivity. And so we really can't separate these things into silos. And so really occupational health, the other point I'll make here is that when we use the word occupational health, it's really a holistic inclusion of health and safety, occupational medicine, and in industrial hygiene. Occupational medicine is kind of that specialty of people with a medical background, kind of a subdivision within occupational health. So to that point is, in addition to when we say occupational health, that sometimes in some industries means the same thing as health and safety. And then occupational medicine usually can sometimes mean employee health. So sometimes these terminology can be a bit difficult to ascertain, and really each industry is a little bit different, but these are the different roles and sort of some of the different terminology we use. So really our goals, if we can break down what we do in occupational health, first of all, what's intuitive, what we're talking about in the seminar today is really protecting workers from health and safety hazards. So that's where risk management comes into play, and assessing degree of risk. And really it's I look at it as a partnership between health and safety and occupational medicine. The health and safety department of an organization is going to ascertain that risk hazard. They're doing the monitoring. They're looking at the workplace, the condition of the equipment, all those other things. And as an occupational medicine physician, what I'm trying to do is saying, given this particular hazard, what is the actual risk that's associated with that, the health risk? And that seems like it might be intuitive, but really, if one thinks about it, let's take the example benzene, for instance, is that if you're not monitoring, you're monitoring for benzene, you're looking at levels, you're following those threshold levels, but really, why are we doing all that? And really, it's that down the road is for workers can develop anemia and go on and develop different kinds of blood cancers from that. And so that's where occupational medicine kind of comes into play, is kind of keeping in mind what's the end game, and that if you can have a good communication between occupational medicine and the field and health and safety, then you really have kind of the big picture, the full picture there. Not only that, but we also in occupational health evaluate workers on if they are able to do their job, and that goes back to some of those chronic conditions that I mentioned. If they've been injured in an accident, can they go back to work? Can they go back on a work accommodation? And with privacy rights, as we might expect, patients or employees don't have to divulge that to their managers or to human resources. They can divulge that to us, and then in occupational medicine. And then our job is really to tell those people, operational managers in the field, what the person can or can't do. So the more I understand about what the nature of the job is and what their condition is, then the better that I'm able to do that. And so I really look at, we're largely in the clinic as occupational medicine staff, and we really look at health and safety as our eyes and ears to tell us that information or give us the tours in the field to kind of better understand this. It, again, sort of the net effect is it makes a safer workplace environment. As you might expect, when someone's acutely injured, or if they have an illness or an exposure, we're going to assess that and what medical care needs to be done. And then lastly, that holistic approach that's moving into the field is we assess them related to personal health. What are some other chronic conditions that could affect them? And please feel free to put any questions you might have in the chat. And then At the end, I'll budget enough time for us to try to answer at least as many as I can, and I'd be happy to answer if I don't get to all of them separately in emails. Really look forward to communicating with you all. So what are some of the directives that we operate under? One is OSHA's General Duty Clause. And, we really look at, OSHA has a number of different medical surveillance programs. They have some different regulations regarding hearing protections, respiratory protection, but there is, at a given chemical plant, there's 20,000 chemicals, and we do not have specific OSHA directives for all of the different exposures that an employee might have. And that's where that general duty clause is so important, is that in general, the general duty clause says that we are responsible for the overall health and well-being of workers. And so a lot of our directives and a lot of our regulations from within an organization comes from that general duty clause. We also have lab standards because we a lot of times do in-house labs. I'd mentioned the respiratory protection standards. Benzene medical surveillance is another example. A lot of other standards all under OSHA. We also have State Department of Health Services. For instance, if we identify a communicable disease, like tuberculosis, for instance, we are required by state law to report that. So that is under state regulation. Especially in the healthcare industry, we do a lot of our accreditation is under the Laboratory Animal Care Accreditation Act, as how we monitor for potential issues working with lab animals. And then lastly, a Joint Commission for Accreditation for Healthcare Organizations, or JCAHO. That is an organization that monitors hospitals and clinics for the quality of healthcare that they're delivering and the safety of healthcare that they're delivering. And we try to adhere to those standards. So components of an occupational health program are really similar to what I had mentioned earlier. We have safety and accident prevention, looking for issues before they occur, trying to anticipate different issues. We identify hazards, and then we have our monitoring and health surveillance. Health surveillance really takes up a large portion of an average occupational medicine clinic. For a lot of occupational health clinics, evaluate oftentimes 2/3 of an entire manufacturing site population for annual audiograms, annual respiratory fit testing. And so usually 20 to 30% of what a clinic does is simply under exposure monitoring and health surveillance. And then lastly, emergency response and disaster planning. A lot of times the EMTs and the paramedics will operate under the medical physician's medical license. And so they often train together, prepare together. Sometimes the clinic will be a combination of an urgent care as well as a clinic, and then disaster planning. Something that we all need to be prepared for, whether that's man-made or natural. A variety of different disaster planning issues can be on hand, and the medical department is a key part of that. The other things is more clinics are injury and illness management, so that goes back to case management. So we oftentimes a simple case, somebody is out for a viral URI for a few days and they come back to work. Oftentimes we don't get involved in that sort of thing with the clinic. They just go back to work. But severe injuries and illnesses, that's where case management comes in, and it goes back to what I'd mentioned earlier about managing the case. Can a person go back to work? I often remember a case of a person who had a partial rotator cuff tear, and I had sent them back to work on limited duty. And then I saw them 2 weeks later, and they developed a full rotator cuff tear. They hadn't held back on their work enough to prevent them from getting an even worse injury. And I always think about that case, and our work accommodations, we try to be as specific as we can, try to anticipate it. We try to do close follow-up for injuries like that. We also get involved with international travel in these international corporations. So what kind of vaccines does somebody need who's traveling overseas to a particular country, or somebody that's visiting from overseas? How do we need to monitor them? And then ergonomics, which is a key part of what we do, particularly with a lot of people at home offices now. If you're not in the proper ergonomic setup, or if you're working in an area that's not really situated to your body type, or you're not in conditioning, you can develop some severe musculoskeletal programs. So we oversee those programs. In the area of safety and prevention measures, we often work closely with health and safety for a job safety analysis to really understand a particular job, or if it's a new type of job. On the hierarchy of controls, we try engineering controls first if we can't eliminate the problem altogether, and also specify what kind of personal protective equipment, if we need to use for a particular hazard. Should they get an N95? Should they have a half face mask, respiratory protection? All those things we work closely with to determine what's appropriate, both for a given hazard and for that individual's particular medical condition. Regarding to exposure reporting systems, I mentioned reporting to the state. We also have other issues that we report for hotlines for exposures. Sometimes if particular x-rays or chemoprophylaxis for different antibiotics, we have exposure reporting systems for that. And we are also, all these reporting systems, we don't want to report it to the wrong people. We want to stay within compliance with HIPAA, which is the medical privacy right regulations. So in addition to monitoring the employee who might have an injury or illness, we also do pre-placement medical evaluations for new employees. And so similarly, we consider what the job description is. We look at their health history questionnaire. We look at conditions that might make them particularly susceptible. And then we determine if a person indeed can be in that role, or what accommodations need to be in that role. And then the manager then decides, can those accommodations be made? So this is a particularly important part of what we do. And again, to prevent injury or illness before it's ever happened. As far as medical assessment of employees once they're hired, we also do baseline medical data. So if we say, for instance, somebody has a hearing deficit, we want to monitor that before they ever came to work. So it helps us to determine, is this person's hearing deficit, was it due to something that happened before they started work, or is it indeed being exacerbated by an exposure? We do a lot of education. So if you go back to the hearing exposure example, we educate on how to wear earplugs, the proper use of earplugs, why you should do that. Is there something unique about their ear canal that we might want to do customized earplugs? All that's part of the education, and the need for us to develop a good relationship with employees. So we look for opportunities to go out to the field and talk with employees so that they trust us. And that's really what it's all about, is trust, because the employee is trusting us with their medical information to be kept confidential. And we're trusting them to report some issue before it's ever happened, potential injury or illness has happened. And then follow up, I'd mentioned how important it is to follow up closely with somebody that has an illness or injury. And when I say here in this documentation of exposure route trend analysis, basically, is the person getting better? Are they getting worse? Are they the same? Have they reached a plateau? All that's important for us to note. You may be wondering, well, why is the medical doctor seeing this employee so often? I mean, I can't see any change. Well, that's really what we're trying to do, is trying to see, is this headed in the right direction? There's a phrase, MMI, maximum medical improvement. If we feel like a person's plateaued and they're just not going to get any better, or not any better in at least the foreseeable future, then we'll have an MMI evaluation about, this is their baseline and this is what they can do. And that's part of that route trend analysis. And then, in it, we'll take into account somebody's medical background, their individual circumstances, as well. Sometimes that could be financial or some family member that's having problems. We take all of that into account. I mentioned vaccines earlier. We're responsible for giving these vaccines for travel or new cases that come up. And it also depends on the type of job that the individual has, whether they're more susceptible to transmitting a particular infectious disease. So we do a lot of vaccinations. Influenza is a big drive every year that we do. And then going back to case management, in addition to managing the employee's individual case, from our standpoint, we also evaluate what kind of specialty care that they're getting. So is the orthopedist making appropriate recommendations? In regards to an orthopedist, a lot of times, is back surgery appropriate, for example? If we have evaluated their history and we've looked at the imaging studies and reports and we feel like something's not really matching up with what our specialists are recommending, then sometimes we'll recommend a second opinion. That's ultimately it's the employee that's going to decide how to proceed with that. But again, building that trust and saying what we recommend and what's appropriate, that comes into play. The modified duty can make a huge difference on when a person can come back to work. There's a lot of literature that shows that if employees are at home and they're not coming back to work, the longer they're out, the higher the chance that they'll never come back, that they'll be out on disability. And, for those people that truly have a significant disability, well, that's very appropriate. But for an individual that, might or might not have a disability that they could come back, well, that's a shame. That's a loss of a lot of psychosocial issues as well as productivity. It's important I'd maintain open communications, not only with the patient or the employee, but also with human resources, with operations manager. That's what an occupational medicine doctor does, is portraying, relaying all this information. And a lot of times I'm a physician, so I say physician, but this is also very applicable to, a lot of times at some plant sites, you'll have a registered nurse is your main occupational contact. So a lot of times our RNs and LVNs will operate with the MD, but that they're the relay person. And in the long run, like I mentioned, we really want to avoid permanent disability if we can help it. We can restore this person back to a full and kind of meaningful life and career is what our ultimate goal is. I'd mentioned health promotions earlier in the talk, and that's really important too. I can't really want to emphasize how important that is that oftentimes us in an occupational clinic, we're the bearer of bad news. We're the ones that tells the operations manager, this person's not going to be able to go back to work. And by the way, this was an OSHA recordable injury. And so health promotions in a way provides us with a way of looking at this positively, is that by keeping your workplace healthy, by having a culture of health and wellness and understanding, we are preventing injuries and illness. And there is a lot of data that can back that up. When you look at absenteeism and health and presenteeism data, it shows that a healthy population misses less work and has lower medical costs. So having that is important. So having wellness programs, and not only, kind of think of a wellness program as sometimes what I envision is a nice gym on site and exercise bikes and maybe a yoga program at lunch. And that's great to have all that stuff, but it's also important your key people that are most susceptible to occupational injury are the ones that have least access to health promotion programs. It's the night shift. The night shift people that don't have access to healthy food, they don't have access to health promotions. So a health promotion program that's available to all is expressed in terms that's sort of culturally appropriate for different individuals and different job types. All those things are important to really kind of go where the money is, where your really at-risk people are. And again, the occupational medicine health staff in the clinic really needs to be operating with the health and safety team, with the industrial hygienists. If we're all on board with a health culture and we're looking for opportunities to talk to people and to implement programs, then we're all much more powerful than we would be as if we were siloed. So I encourage you, as you go into this field or go into a new job or a new role, to seek out a health partner and maybe try to build bridges, regardless of what the reporting structure is, to develop some of these community programs. So, and then this really slide is a lot of words here. I need to shorten this, but it's basically have objective measurements. Try, it's good to kind of eyeball it or have a gestalt, but it's also look at trends in employee injury data. And again, sometimes we'll look at medical costs and medical cases in the clinic, but we won't be looking at first aid reportable injuries and illnesses that's maybe kept by health and safety. And if we can combine that data, if we can look at that, if we can talk about it, then again, we have a lot more powerful program. And also the cost benefit analysis, that's what operations wants to look at. If you can show these managers that you are saving money if you invest in this program, or then they'll start listening to you and start backing you up on some of these different programs that you're implementing. And it resides in a lot of different areas. It can be in-house in some of the larger companies, or it can be the local Concentra clinic, or it can be a local private provider that comes over to the corporate side a couple times a week. There can be a lot of different arrangements, and there's no one right arrangement that works. Really what it boils down to is the individuals and the people that are willing to kind of commit to a good occupational health program. I think, Scott, so we only have 30 minutes. I might pause here if that's all we've got. We have a case respirator evaluation that I might talk about later, but I think I'll pause here if we've only got 30 minutes and just take any questions that might come up.
Yes, sir. Yeah, we've got 5 minutes. Thank you very much, Dr. Perkison. If anybody has any comments, questions, or discussion items, now is the time. I can tell our participants that here at the UT Health Science Center in Houston, we consider this an ALAC year. What that means is we are expecting our 3-year reaccreditation site visit from ALAC. And so there are a variety of occupational health considerations for our animal care and use program that ALAC looks at very closely. And so we interface with our Animal Welfare Committee, or IACUC folks, our animal care and use departments, meaning our veterinarians, as well as all of the associated staff, and with the occupational health program as well. So that's a really important interface for animal care and use. I see a hand up from Andrea. Go ahead, Andrea.
Hi again. Can you speak a little bit to the engineering and or administrative controls that you use for the psychiatric hospital? Thinking about all the workers' comps injuries that we were talking about earlier.
Yeah, right. So
Yeah.
I'll let Dr. Perkison chime in, and I can add on after him.
Yeah, no, that's an excellent example, and something I would love to develop more. I've seen. I'm also. I didn't mention, but I'm also in the employee health clinic, so I've seen some of the psychiatric workers that have been injured in the past. You know, I think from my standpoint, one, it goes back to feedback to the staff about adequate staffing, that people have assistance when they're in the psychiatric hospital, that they're not left alone in an area that they can't might be outnumbered or not staffed adequately. I think that could be considered an administrative control. Also going back to just the health and fitness part of it, is that those individuals should have a fitness program. They're less likely to have injuries, illnesses, whether that's lifting over, stooping over. All those things are susceptible to musculoskeletal issues. So that's kind of on me. And then I guess I'll engineering controls. Scott can probably better answer that than I.
Yeah, what's interesting is we have 2 phases of our hospital: the original Harris County Psychiatric Center facility, which is built in the 70s. And we've got a brand new inpatient care facility that's part of the Harris County Psychiatric Center, but it's its own standalone building, and it's got kind of modern amenities and approaches, if you will. So the older building is, yes, admittedly a little sterile. It's got appropriate controls in terms of security and lockdown areas, et cetera. But the new facility has all of those things, but it's a much softer approach. There are a lot of enrichment features of the new building that go a long way in terms of patient satisfaction, and we believe it does have impacts on their I guess attitude and approach with our staff as well. And we do a lot of training. So I'm not familiar if you're, I don't know if you're familiar with the SAMHSA training, but a lot of the de-escalation techniques that are necessary to ensure that our staff know how to do exactly that, de-escalate a situation before it gets to, a kick, a punch, a bite, things like that, where they're getting injured. That's gone a long way for us as well. And so we could spend literally another hour talking about all these features. For the sake of time, I'm happy to have a conversation about this offline, and I can point you to some of these resources if the behavioral health healthcare setting is something you're getting into.
Great. Thank you so much.
Mm-hmm.
Since I guess our time is almost drawn to a close, I just wanted to let you all know that I am over here at the Southwest Center of Occupational Environmental Health, and we're an education resource center. So I really look at this as a neat opportunity to reach out if you all have questions for me. Don't hesitate to contact me. I'm sure Scott can send you my email. I'm available on the web, and would love to hear from you if I can be of assistance in the future.
Dr. Perkison, thank you so much for your time. Really appreciate it. Excellent presentation. And I'll be monitoring the Canvas site as well in case any questions or things come up for Dr. Perkison. I can certainly help to relay any of those things over to him so we can get you guys some answers or information. Moving along, we're heading into the last segment of our second week of the EHS Academy. And it is my pleasure to introduce Alan Lucas, who is over our environmental protection program. And he's going to spend the next 90 minutes with you guys covering hazardous waste management basics. Alan has a lot of experience with hazardous waste management, and I don't mean to boast, but perhaps he could be coined as the gem of the UT system in this regard, meaning among all of our sister institutions under UT system, we get a lot of questions and advice that is sought out from Alan's expertise and everything. So I'll let Alan further introduce himself, to tell you a little bit more about his background, and then we're going to go over hazardous waste management basics. Thank you, Alan.
Okay, great. Thank you, Scott. I didn't know if I was able to share right here.
That's perfect, Alan. You got it.
Looks like I'm up and running. Yeah, thank you, Scott, for that kind introduction. I do, when we give this course in person, I always tell everyone I have the unique perspective that I was a class attendee before I worked at UT Health Houston back some 6 years ago. But I do have the unique position that I've been in this position for 23 years. Whether that's good or bad, I'll let you decide. So we've been able to grow this program with the university, and hopefully going through here, we'll share some of our management techniques that hopefully you guys, that can help you all out. Of course, if there's any questions, we normally have this set up for kind of an open forum where we can talk back and forth. I'm not sure that'll work here, but if there's any questions at the end, or if there's something that I say that's terribly wrong and you want to chime in, feel free. I do have this set up for the live portion today, where we'll talk about the hazardous waste management. And then for your asynchronous portion, I have the environmental program set aside. Typically, there's quite a few questions that come out of the environmental programs section as well. So please feel free to share those next week as well. So as we move forward, there's a few learning objectives that we'll want to make sure we touch on. Essentially, want to make sure that we identify the three major classes of hazardous waste. Of course, those are chemical hazardous. We're going to talk about medical, infectious, sometimes known as biological waste. And then we'll touch on radioactive waste as well in this section. We want to move through and make sure that you understand the 5 distinct phases of hazardous waste management. And these would apply to each of those 3 streams of hazardous waste. And we're not going to go into in-depth regulatory read, but we want to make sure that we at least identify the applicable regulations for these hazardous waste streams. That way, if you have some extra reading that you would like to do, you can go ahead and do that. There have been some technical changes for the chemical hazardous waste as a result of the generator improvements rule. I have some of that reflected in this presentation, but it's really not an in-depth regulatory read into the regulations. So we always like to identify the public health significance of our sections. And essentially, if you think about it, air, water, and hazardous waste disposal affect every individual and community in the United States. So as we manage these releases, we want to go ahead and make sure that we're minimizing that impact and increasing our public health. By doing that, we're increasing our environmental compliance, but ultimately, we're also taking a look at how we're managing these items and looking to reduce any of our operating cost. So for example, in the university setting, typically chemical hazardous waste disposal is about $3 per pound, depending on how it's managed. If we can implement some waste minimization techniques, simple things like bulking, segregating, maybe having a container storage area, we can reduce the chemical waste costs typically in the university setting to about $1 a pound. So this is a significant cost savings, and our leadership appreciates that cost savings, but it also helps to reduce your generator status, which can reduce the regulatory hurdles that one would have to jump over. So speaking about cost, typically after payroll, hazardous waste disposal is the largest expenditure for university safety programs. And I should say traditional safety programs that don't have a lot of insurance or risk management costs built in. Typically, if an organization or an institution generates hazardous waste, they can be categorized as radioactive, hazardous chemical, medical, which sometimes we might call infectious or biological waste, or it's a mixture of any of those previous 3. So I use the term hazardous here pretty broadly. You might think of it as regulated waste, but to our leadership, it's either hazardous or not hazardous. So if we take just a quick gander at the hazardous waste regulations, we do have the federal level regulations, which include the Solid Waste Disposal Act of 1965 and the Resource Conservation Recovery Act, which was passed in 1976 and then promulgated right at the beginning of 1980. And essentially, these 2 acts outline and set in motion the framework which hazardous waste is managed. And so we have some of the sections here listed, and we'll go over these in the presentation. It's also, if you're taking a multiple choice test, important to note that the Hazardous and Solid Waste Amendments of 1984, that added the land disposal restriction requirements for hazardous waste shipments. And then in our universe, being a college university, it's also important to take into account DOT regulations, because we may have materials that are not listed or a characteristic hazardous waste. However, due to some listing or characteristic, they may be subject to DOT regulations. And so some of these things, while they may not rise to the level of a EPA regulated hazardous waste, we would have to dispose of those much in the same manner according to DOT. So essentially, RECRA has several goals, but they're looking at conserving energy and natural resources, of course. Part of this is to reduce or eliminate the generation of hazardous waste wherever feasible. So we'll talk about different ways that they attempt to do that through pollution prevention and things of that nature. They're looking to treat, store, and dispose of waste so that any threats to human health in the environment are minimized. Essentially, what that means is that we're looking at treating waste before it's placed into the ground with the ultimate goal of protecting groundwater. Another important component of RECRA is this idea of cradle to grave management for hazardous waste. And that includes all phases from generation through the transport, where it's stored and treated, who's disposing of it, and then some post-disposal monitoring type period. So ultimately, the cradle to grave means that the generator is always responsible for that waste, even after it's been treated and disposed. So I do have a list of some of the important sections in the Code of Federal 40 CFR, the Code of Federal Regulations. If you're reading this and you're new, this can be a little confusing because we're talking about the Resource Conservation Recovery Act, subtitle C. So that's the act from Congress. But the second part of that is regulations in 40 Code of Federal Regulations. So these are all codified regulations that were promulgated by the EPA to meet the requirements of the act. So we have parts 260 through 279. If you're doing some at-home study, it's good to know the kind of background of the hazardous waste management system in general. Part 261 is important for making the hazardous waste determination. Waste are either on a list or they have some characteristic that makes them hazardous. And then we go through the next couple of sections are the specific requirements that apply to generators, transporters, and ultimately the treatment, storage, disposal facility. That's the facility where your hazardous waste is shipped to. So in making that hazardous waste determination or designation, one would look at something that first meets the definition of a solid waste. And by solid, it could be a liquid, solid, or gas. But that because of the quantity, concentration, or some physical, chemical, or infectious characteristic makes it hazardous, it would cause a significant increase in mortality or some type of irreversible or incapacitating reversible illness. It also might be a material that poses a substantial threat or potential hazard to human health or the environment when improperly managed. That means not treated before it's disposed. Waste are also determined by rulemaking. That's where the EPA has a specific list of EPA listed hazardous waste, or it could meet a characteristic such as ignitability, corrosivity, maybe it's highly reactive, toxic, or if it's a mixture, meaning that we took a non-hazardous waste and a hazardous waste and mixed them together, that would render that entire mixture a hazardous waste. And then the derived from rule, which primarily applies to TSDF type facilities where they're treating the waste and then ending up with some product that may or may not have a hazardous characteristic, but because of its origin, it always carries that hazardous waste designation. So this is really kind of the basics of how one would go about making that hazardous waste determination. There are certain exclusions. So of course, medical waste that do not contain an EPA listed or characteristic waste are not regulated underneath RECRA as a hazardous waste. any of the radioactive material that's regulated by the underneath the Atomic Energy Act, or is regulated by your state's agreement programs. Those are not considered hazardous waste. Anything that's generated as a result of a household, so household waste, are not considered EPA hazardous. And then there's certain exemptions for farmers that are engaged in agriculture. Certain mining overburden waste that's returned is not considered hazardous. The oil and gas industry gets an exclusion for their drilling fluids. One that sticks out is any of the older arsenical treated wood that is now old and is discarded. That's specifically exempted. If you have oil contaminated media from any type of underground storage tank cleanup, as long as it does not contain an additional hazard, then that would be exempted. The spent or used CFC refrigerants that are reclaimed don't fall under this regulation. And then one I really like is the non-turn plated gravity hot drain used oil filters. These would typically be oil filters that were treated with some type of corrosion inhibitor. Typically that would be lead. And these were typically used in larger engines for, say, large emergency generators. So these would be specifically exempted if they were non-turn plated. Then, of course, any of the used oil distillation bottoms that are used in asphalt. Not sure we'd see those at the university, but it's good to know that those are out there. So I mentioned in the start of the presentation that we essentially had a 5-step process for managing hazardous waste. It starts out with the generation, so we'll have certain activities, procedures that the generator is required to complete. We would have some type of policy procedure for collecting the hazardous waste. That gets moved to a storage and management facility where it's stored, bulked, consolidated, and then ultimately we would have that waste go through a shipment process. It would arrive at the TSDF and then be disposed, treated and disposed. So in this process, based on the amount that you're generating, you may require different levels of plans, record keeping, reporting. I call that regulatory scrutiny. For example, if you're a large quantity generator, then you would be required to have the full emergency response contingency planning, have increased record keeping, and a little bit of an increase on the reporting. So I've got this in essentially the chemical hazardous waste section, but these 5 different principles apply to chemical, biological, radiation, whatever type of waste we might have. These are the general principles. So in speaking of generation, we want to make sure that we incorporate some type of waste minimization strategy into our training programs. And then prior to any experiments or laboratories, we want to make sure that we're playing some type of a role with the key stakeholders. That way we could come in and maybe suggest alternatives, replacements, or maybe a part of the experiment that, I don't want to say treats the waste, but makes the waste into a less hazardous form before we collect that for disposal. We want to use our laboratories as satellite accumulation areas. That helps with the next phases of collection and transportation or storage. We want to make sure that the generator is labeling their containers appropriately. This is one of the things that changed with the generator improvement rule. So they're having to add some type of signal word or pictogram. And then from a safety standpoint, we want to make sure that they're minimizing any spills. One of the best ways to do that is to utilize some type of secondary containment in the satellite accumulation area or in the labs where this waste is generated. As far as collection, Most of you know researchers, and they typically can figure out solutions to their own problems. So we have to make it fairly simple for researchers to dispose of hazardous waste. That helps to encourage compliance. If we make it a cumbersome process and we bill back, sometimes researchers will find creative ways to go around our systems. So one easy way to do this is to use a phone voicemail system or some type of web-based request for submitting waste pickups to EHS. One of the keys here is to not push too much of the work back onto the researchers. By that, I mean, if they have to fill out extensive profiles in order to use an online system, sometimes they're not likely to come into compliance with that. So we do like to use the hazardous waste label as a collection tag to fulfill any record requirements. So one of the ways that we're looking at doing this is putting a generic label onto the waste container, which identifies the material and has all of the appropriate signal words and pictograms, and then adding a label that has the words hazardous waste and the date to fulfill the record requirement. It's important to track the waste internally as we collect it. That helps us to determine our generator status. And it's also important to log that volume generated for each site or laboratory. That way you can go back on an annual basis and report that information to your leadership, to regulators, and to the laboratory staff themselves. So here I have an example of just a simple Excel spreadsheet that I've used in the past to track hazardous waste. Essentially, I have our site location, address. I have the EPA identification numbers listed. So I'm recording the date, who the PI is, where it came from, essentially what the chemical is. And then the next series of information is essentially looking at estimating the amount, the volume, or the weight. So I like to do weight because that's how the regulations are written for the less than 220 pounds or greater than 220 pounds per month. And then at the end of each month, we'll have a running total so we can easily prove to anyone our generator status. As far as the in-house management, we want to make that determination if a waste is regulated. This is part of the hazardous waste determination, and some of the clarification in the generator rule moved from language that essentially said the generator of the hazardous waste, which left that open to say the University of Texas Health at Houston or UT Health Houston could make that generation, to saying that it has to be a person. We want to quantify the amount of waste generated. We would determine our generator status. If we were above the 220 pounds per month, then we would need to obtain an EPA identification number as well as a state registration number. We would do that by essentially filling out the paperwork. In Texas, we can go online. Other states may be a little different. Once we have that set up with our notice of registration and our state waste codes, then we would have to submit annual waste summaries, make sure that we're training our people on the emergency response actions underneath RCRA on an annual basis. For any small or large quantity generator, pollution prevention planning is required. So we would submit that pollution prevention plan, and that's submitted on a 5-year basis. And then there's different levels of contingency planning for essentially small quantity generators. There's less requirements, and for large quantity generators, there's the full contingency plan that's required. So is the waste regulated? That's the big question, making that hazardous waste determination. So first we would consult the the RECRA regulations in 40 CFR 261, and we could look at the list of hazardous waste and compare that to what we have. If it's not on the list, then we would need to look at the characteristics of the waste. And I mentioned that before. That was the ignitability, the corrosivity, toxicity, reactivity. We might have a RECRA universal waste. This is a subset of hazardous waste, but they're items that are pretty ubiquitous throughout our facilities, such as rechargeable batteries, fluorescent lamps, maybe mercury-containing equipment. I mentioned the DOT hazardous materials. So we'd want to look at the characteristics of the material to make sure that it's not regulated or is regulated by DOT. And then finally, we might have the non-regulated, that would be the non-DOT, non-RECRA waste. But it could fall into a class 1, 2, or 3 industrial waste. So for the majority of universities, we should really have no industrial hazardous waste that's being generated. If you have these listed on your NORs, your state or EPA has probably asked you to take those off as active waste codes. However, there are certain items that are always classified as industrial hazardous waste. One of these is any type of grit trap waste from car washing operations. It's always considered a class 3 hazardous waste. So in making this haz waste determination, we can look at the list, and they're divided into 4 categories. So in our universe, we typically have the F, U, and P listed waste. F are from non-specific sources. We typically think of these as the spent solvents that are left over from research. So it may be things like alcohol, xylene, other solvents that are utilized. The U list is for new commercial chemical products. And when I say new, it's new and the sole active ingredient. So for things on this list might include pyridine, different acids. And then we have the P listed, or acutely toxic hazardous waste. So this also follows that it has to be new, unused, and the sole active ingredient. Here we're looking at things like osmium tetroxide, maybe sodium azide, but not sodium azide that has been mixed into a 0.004% solution used and then given to you. That's no longer considered unused and the sole active ingredient. I don't know of any K listed waste from universities. Typically, if you have a K waste, you would know that because you've negotiated that waste listing with the EPA. Then we have our characteristic waste, and that's things that are meeting this definition of ignitability. They get listed as a D001, and that applies to materials with a flash point less than 140 degrees Fahrenheit. So that might be toluene, xylene, and I have oxidizers listed here as well. So oxidizers are also considered a D001 ignitable waste. Where we see this is some of the oxidizing nitrates, but also concentrated hydrogen peroxide solutions as well. The next characteristic is corrosivity. This is D002, and it applies to aqueous solutions that have a pH less than 2 or greater than 12.5. As a management technique, if someone hands us a container of solid sodium hydroxide, we go ahead and label it as D002 hazardous waste, just because we know that over time, those materials tend to absorb water and they tend to turn into a liquid. So we go back and forth on this with our vendors sometimes because they will routinely not classify a solid as a D002 waste. The next is reactivity. This can be for materials that are unstable and undergo a violent change. Applies to chromic acid and perchlorates. But you also might see this waste code being used as kind of a default because there are many chemicals that can be dissolved in water that if you add hydrochloric acid, that reaction will evolve chlorine gas. And so that's the way you may see it on safety data sheets sometimes, is that it evolves chlorine gas whenever it's mixed with hydrochloric acid. The final is the characteristic of toxicity, and it actually has 39 different chemicals that are listed underneath this section. Essentially, this is looking at how much of your waste would leach out of a landfill if it was placed into the landfill untreated. So the EPA has devised a specific test. Essentially, they have a porous bag that simulates the landfill liner. They add water to that, and they see how much of your chemical ends up in the water sample that's recovered. And if you exceed that level, then your waste would be considered hazardous underneath the EPA. So this applies to things like lead, vinyl chloride, mercury, some of the other RECRA metals. So this is really kind of a catch-all. We rarely perform a TCLP test with our waste material. What's more commonly done is that we would take a sample of our material, and if it contains lead or it contains mercury, if we do a laboratory test, we might do a total mercury or a total lead, and then just use that in a conservative manner to make that hazardous waste determination. So a lot of times we're really overestimating the amount of hazard in our waste. So this is fairly new. I say new within the last 10 years, the RECRA Subpart K lab rule. This applies to academic entities. They can make the choice essentially when and where to make their hazardous waste determination. This can be done in the laboratory at the time of initial generation, or you can have up to 4 calendar days whenever it arrives in your container storage area. As a part of this provision, individuals that make that hazardous waste determination have to be trained professionals, but there's no specific definition on what that means. So it does provide some other regulatory incentives to conduct laboratory cleanouts. So you could do laboratory cleanouts up to 1 time per year from your laboratories. And then that waste would not count towards your generator status. So there are some additional requirements. There is a laboratory management plan that's required. So it has part 1, which would be enforceable. And this is essentially where you would be identifying your options or your procedures for how you're labeling your hazardous waste collection containers, and then identifying your procedure for how they're removed from the laboratory. The second part is essentially your best management practices. And in implementing these laboratory management plans, it would cover all of your laboratories at that EPA site that opt in. I don't know too many that would have multiple EPA identification numbers for the same site, but the LMP essentially can be fairly flexible, just like a contingency plan, where it covers one site, one EPA identification number, or multiple in that same plan. Essentially, your LMP can be part of some of your existing plans. So say everyone probably has their chemical hygiene plan. That could be written in as an appendix into that plan, so you don't have a separate binder or a separate set of procedures to achieve this. Many of us are already doing what would be required in an LMP. So it essentially allows universities to legally manage waste, hazardous waste, the way that we do for for it to make sense with the diverse research community. I think I skipped one thing here though. In order to implement the subpart K lab rule, you would have to submit that laboratory management plan to your TCEQ or state equivalent for approval before you could take advantage of these regulatory, I don't want to say exemptions, but the flexibility afforded to universities. I spoke a little bit about the hazardous waste generator improvements rule. So if you're in Texas, that has finally come through as of 2 years ago. The EPA final rule went through back in 2017. However, some states were slower at adopting these provisions. So essentially, the aim of the EPA was to make clarifications to the hazardous waste rules that would provide more flexibility to generators. I'm not sure that it really achieved that for the university setting. But essentially it allowed for some provisions for generating episodic waste, so that would not count towards your generator status. And it allows very small, that would be your equivalent of the conditionally exempt generator, to send hazardous waste to a large quantity generator under the control of the same entity or person. So that second provision could be fairly useful for most colleges and universities that might have a large quantity main campus and then maybe some other satellite. I don't want to say smaller locations that are not adjacent to the main campus. So I could see it being helpful there. Just a quick review of the generator status levels. So essentially a large quantity generator can accumulate hazardous waste on site for 90 days. And this would apply to generators that generate greater than 2,200 pounds of hazardous waste per month, or if they have greater than 2.2 pounds of P-listed waste. So you can see down for the requirements, they're required to have the EPA identification number. You're required to manifest your hazardous waste. If your TSDF does not send the manifest back to you within 45 days, you're required to file a report with the EPA. Biennial reporting is required, so you have to submit a report every 2 years of your hazardous waste generation amounts. As far as compliance, you would have to follow the full requirements with Part 265, and then keep the emergency preparedness, contingency, and training according to the large quantity standards. For small quantity generators, the level is between 100 and 1,000 kilograms. So that means if you generate less than 2,200 pounds of waste a month, then you have reduced requirements. And for very small quantity generators, that reduction is even further. But that means that you're generating less than 220 pounds per month, and you're not generating greater than 2.2 pounds of any P-listed waste. So the key here is that if you generate 100 pounds of flammable waste or ignitable characteristic waste, and then you generate 10 pounds of a P-listed waste, even though you've generated a relatively small amount of waste in total, that P-listed waste threshold has been exceeded. So that sends you straight to the large quantity status. So as far as storage, satellite accumulation areas are designed or designated to be storage areas for hazardous waste. They can be in the laboratory or they can be in other designated areas near the lab. However, they have to be under the control of, the regulations say operator, but we mean that to be someone that works in the laboratory and is responsible for generating that hazardous waste. So essentially, you could store up to 55 gallons of hazardous waste, or 1 quart, which is about 2.2 pounds of P-listed or acutely hazardous waste. As long as you haven't exceeded those two thresholds, then there is no time limit for how long that can be stored. However, once you exceed the 55 gallon or the 1 quart threshold, then that waste has to be removed within 3 days. So in the laboratory, it has to be stored, or hazardous waste should be stored in compatible containers. That's a requirement in the regulations. If you have any incompatible waste, those have to be segregated, typically by some type of physical barrier. We like to use these gray totes that act as secondary containment. They provide a pretty good barrier. Containers must be, they're required to be kept closed, except whenever you're adding or removing waste. They have to be in good condition. They can't be cracked. They have to be marked with the words hazardous waste. They have to, under the new generator rule standard, be labeled with the hazard or signal word, or they can have the DOT labeling. It's not required, but it's a good idea to have them stored in secondary containment. That way, if there's any spills, leaks, if the researchers just don't fully tighten the lids and there's a slight spill, that's kept from making a bigger mess. And then I say when full, removed from the laboratory within 3 days. So full might mean 55 gallons or the greater than 1 quart of acute toxic waste. But as a good management technique, any container, once they slap the date that says it's full, we're going to try to make sure that we remove that from the lab within 3 days. That way we are never in jeopardy of storing waste in a designated satellite accumulation area greater than that 3-day period. So our container storage areas, that's essentially the place that we take the waste from the laboratory to. These are typically registered as hazardous waste management units with your state or the EPA. And all of your containers must be marked with the word hazardous waste. They have to include the date that you began storing the container. And they also have to, once again, be labeled with the hazard. So you would comply with whatever your accumulation time limit is. That's the 90-day time limits for large quantity generators. And if you're a small quantity or a very small quantity generator, you'd want to make sure that you are paying attention to your total accumulation volumes. In these areas, there is a requirement for secondary containment. So that's the volume of the largest container, or 10% of the aggregate volume. So typically your largest container in one of these rooms is going to be a 55-gallon drum. And there are different ways of achieving the secondary containment. You can use plastic spill decks, but I find that it's always better to build these features into the room itself. So that can be achieved by adding a berm near the doors that would provide for that 55 gallons or 10% of whatever your total volume is. Moving on with the hazardous waste storage areas, they do have some requirements that they have to be at least 50 feet from the property line. There are some exemptions to this that are listed in the generator improvement rule. If you do have incompatible waste, and for us, and for many of you, that's probably something like your corrosives and your flammables. Those have to be separated by some physical barrier, maybe a dike, berm, wall, some other physical barrier that prevents those from intermingling. You're required to keep aisle space to allow for emergency response. That's meaning emergency personnel to come in and do inspections, and enough room to move equipment such as drum dollies, drum plugs, things of that nature in and around the room. Also in your container storage area, you're required to do a weekly container or weekly inspection. That's essentially looking to make sure that you have your safety equipment available, that your containers are closed, that they're labeled, things of that nature. If you are looking at doing any type of treatment and you don't wish to become a RCRA Part 2 or B applicant, then the treatment should be part of the process. Things that are allowed without that second permit or that second part of the permit include things like elementary acid-base neutralizations. One thing to keep in mind about neutralizing acid and base is that it typically generates gases and heat. So you typically need some type of dedicated facility that provides some type of engineering control, such as a vented enclosed sink. There are totally enclosed treatment units. These are typically used for recovering solvents, metals precipitation. It's actually a replacement reaction, but it falls underneath this category. This could be for silver recovery type units. If you have any of the black and white photographic processes, this is something you might consider. And then the final is any on-site permitted wastewater treatment units. So some of our universities are large enough that they may have their own wastewater treatment facilities. Anything that's a permitted release would be exempted from the hazardous waste regulations. So I do have an example of the silver recovery unit. These are typically gravity fed systems. Larger systems could be larger systems, may have a pump or may operate as an electrolytic system. These do have to be managed on a regular basis. They typically have to be changed out every 6 months to a year. And as the black and white film processing industry has changed, service providers have become far fewer to find. I saw a note pop up real quick and I couldn't quite get to it, but it was quenching some type of bath. I would have to go back and know a little more about that process if that's something that we'd want to do. So maybe we can bring that up in the question section. As far as shipping this stuff off for disposal, you would want to make sure that you're using a approved hazardous waste transporter. For those of us at UT System, we do have a UT System contract. So that's going through an approved transporter, going to an approved facility. Before the waste vendor shows up, we want to make sure that we want to try to package and label that waste as best we can for shipping. Vendors are rolling out more and more online options where we can enter the information ahead of time, and then they send us the labels that we can attach to lab packs or drums. We want to review the hazardous waste manifest on site, make sure that we're signing and retaining the land disposal restrictions. That typically I like to put that directly behind the hazardous waste manifest in the records. And then keep in mind, you as the generator are responsible for this waste for its entire lifetime. So the waste manifest, or this hazardous waste manifest, really provides the cradle to grave tracking. I know that we've moved to what they call the e-manifest system, but typically the vendors will still show up with a carbon copy manifest of the form. So essentially the generator would sign that, the transporters would sign the manifest, the TSDF would then sign when they receive the waste, and then we would get a final copy that shows all of the people that managed that waste while it was transported and treated for disposal. So when you're signing the manifest, you're confirming or affirming that the manifest is completed. And by complete, I mean that it has all of the EPA identification numbers, that it accurately describes the shipment, and that that shipment is ready for transport. There's some other paperwork that should go with this. I mentioned the LDR, the land disposal restriction, but you may have drum inventory sheets or packing inventory slips. Ultimately, you're going to have your invoice that you paid, and then you should have some type of certificate or waste tracking report that details how that waste was ultimately treated. A little more about the record keeping requirements. The handlers are required to sign it and retain a copy of the manifest. I mentioned before filing an exception report, and that's if you don't receive that return manifest from the treatment facility within 45 days. So you're required to keep your signed manifest at least 3 years after the shipment. And any waste reports that you turned in, those would need to be kept for 3 years as well. We also would keep any, I would call them annual waste summaries or biannual waste summaries. Those need to be kept for 3 years as well. And then if you're doing any testing to make your hazardous waste determinations, those also need to be kept as well. I would almost recommend for these type of records that you could keep 3 years on hand pretty close, but I would go against your document retention policy and just go ahead and keep these records forever. And part of that is because of the generator's cradle to grave responsibility and the idea of joint and several liability. So if at some point 10 to 15 years down the road, whenever the TSDF closes, you would have a record if you were named as a potentially responsible party. Some notes about the contingency planning. Number one, it has to be written. You can't just have this as a plan that you've sketched out in your head. You should have appointed emergency coordinators, more than one. There is a requirement to install certain emergency equipment. This might be telephones, to have radios available, fire extinguishers that are appropriate for your waste types, things such as hoses, sprinkler systems. There is a requirement for communication with local authorities if you need outside assistance. That would include coordination with your fire department, police, hospitals or healthcare, and then even potentially your state or local emergency planning committees. Typically, the communication with them would be through part of the tier 2 type reporting process, but you could also report your contingency plan to them as well, depending on what you have. If you do have emergency information, it should be posted in your telephones. I know that as we've moved forward with technology, I tend to keep a lot of my emergency information in my phone, not just near it. Waste minimization is required if you're a small or large quantity generator. So you're required to have a pollution prevention plan. Essentially, that plan asks you through education or through changes in process to ultimately try to become a non-regulated generator of hazardous waste, meaning you would be conditionally exempt or fall into that very small quantity status. Ways that this can be achieved, you might have different training programs where you train new employees or you train laboratory staff through your review process. If you could look at the protocols before they're approved, you might be able to avoid acute hazardous waste, avoid any of the mixed waste, which can be more problematic to. If you can, you would like to have treatment as part of the process, without calling it treatment, but have the end of the experiment where it ends with a less hazardous material. You could look at recycling. However, there is a section in the regulations that addresses sham recycling. So you have to be careful that you're doing this above board. One of the things that we've been very successful with is this idea of consolidating or bulking our waste. That way we're not shipping out half-empty containers, which the vendors typically record as a full container. So on paper, we're essentially showing a significant reduction in the amount of hazardous waste. You could also move through and do your own in-house lab packing, where you better characterize the chemicals that you're shipping out for disposal. And then ultimately, we put this in maybe as a test question, but the elements of waste minimization. So the number one priority, we're looking to replace the chemical with something less hazardous, and then reduce the amount we're using. Then if we can, we'd like to reuse the chemical without any further processing. And then the last option would be to recycle the material for future use. So lab packing is essentially just placing compatible chemicals, generally in their original type container, inside a larger container for shipping. A lot of the hazardous waste disposal vendors, this is built into their service contracts. And they do this because they want their staff to pack the chemicals that are going into their incinerators. At least that's the way it typically works through the UT system. If you have other type vendors, then you may be able to pack this into a lab pack container that vendor would then take to their storage facility, and they're going to unpack it and then repack it to go to wherever the most cost-effective vendor is. For many of us, it would help to avoid the costly void space if we're able to lab pack and consolidate chemicals into common containers. So essentially, it represents a great opportunity to control our cost and to reduce that cost obligation for hazardous waste disposal. Another benefit is that your personnel would become intimately familiar with the chemicals they collect. So they're going to be looking these up, looking at the safety data sheets, looking at the DOT regulations to make sure that they're getting these compatible chemicals into a container and getting that labeled correctly. But it also provides a screening process and a chance to correct any incorrect labeling. So it really works as an in-house quality assurance program as well. So for lab packs, they can be in two varieties. What's colloquially called a slam pack would apply to non-regulated or non-hazardous materials. Essentially, this is us putting non-regulated materials into a large trash can. But the cost savings here comes from not allowing or not having the vendor sort through these non-hazardous chemicals. And one cannot just simply go out and place a 55-gallon drum into the regular trash. So we would then self-transport this to the landfill, which provides a significant cost savings over having a vendor transport this to one of their non-hazardous landfills. Prices have gone up, but right now it's about $60 per drum for us to take a non-regulated drum to the landfill. And if we were to ship that off through our vendor, the cost is typically between $500 and $600 for them to take care of that. So it does provide a great cost savings. A note about pharmaceutical waste. So in general, there are drugs that are listed by the EPA as hazardous waste. Those would be required to be managed as hazardous waste underneath the RECRA requirements. So some examples of that include certain chemotherapy agents, things like warfarin. A particular note, any of the nicotine FDA approved products for smoking cessation, they're exempted from that nicotine acute toxic waste designation. So if you have things like nicotine gum or nicotine patches, those can now be disposed of as non-acute hazardous waste. However, the vaping solutions that are not FDA approved do not enjoy this exemption. And then in general, hazardous pharmaceuticals are prohibited from pouring down the drain or discharging to the sanitary sewer. If you have your non-hazardous pharmaceutical waste, those are commonly incinerated by medical waste disposal vendors, and they're not included in your record generator status numbers because they're non-hazardous, non-regulated pharmaceutical waste. If you do have any controlled drugs, meaning controlled by the DEA, then they would be disposed of through a DEA-approved process. Typically, that's a company that's designated as a reverse distributor. Companies that we've used in the past include Sharps Compliance, Heritage Environmental, and our hazardous waste disposal vendor, Veolia. One note about using your hazardous waste vendor, they probably have a pretty steep fee just to come on site and set up. So if you could find about 10 to 20 DEA registrants to take care of at one time, that would help it become a little more cost effective. We'll kind of switch gears here, moving away from the traditional chemical hazardous waste and talk a little bit about our facility related waste. So typically these contain items such as our fluorescent lamps, spent or used ballast, used oil, rechargeable batteries, and then some of the paint solvents and potentially diesel fuel. So all of these items are pretty common on campus, and they may be regulated underneath RCRA. As far as the PCBs, that would be TSCA, Toxic Substance Control Act, and then maybe even DOT. So for the universal waste standards, these are a subset of hazardous waste, but they're standards that are aimed at reducing the regulatory burden on managing these widely generated items. So it applies to things like rechargeable batteries that may be hazardous, due to a characteristic. They contain lead or acid, certain pesticides, mercury-containing articles. For us, this tends to be a lot of the sphygmometers, and then also used lamps. So there's two designations. There's a large and a small quantity designation. Small means that you would store less than 5,000 pounds of waste on site at any one time. But it really provides the regulatory relief in that your training requirement is greatly reduced and your labeling requirements and record keeping requirements are greatly reduced. So this would not go out on a hazardous waste manifest. Typically, it goes out on a bill of lading or a special waste manifest. The caveat is that any of these universal waste have to be shipped to either a large quantity handler or a universal waste recycling facility. And essentially the universal waste standards, in the regulations, they leave it open for states and the EPA to add additional waste to this program. So for us, the facility related hazardous universal waste include fluorescent lamps, batteries, pesticides, mercury thermostats, and mercury containing devices. Some of the basic requirements for labeling, all of these materials have to be labeled, and it's typically something along the lines of spent fluorescent lamp, universal waste, and then the date. So we're not exceeding that 1 year storage limit. Employee training is required. However, it's pretty basic. It essentially just has to cover how to handle a spill of the material. The prohibition is that they cannot be placed into a landfill, so we can't throw these into the regular trash. And then if we do have any releases, we need to have a response to minimize the exposure to employees through aerosols, things of that nature. PCBs were banned back in 1979, and they're subject to the requirements of the Toxic Substance Control Act. Essentially, if you have older buildings, you may see these, or you may see ballasts that are stamped as no PCBs. As a policy, we tend to recycle all of our ballast just to make sure that we're not disposing of them in an incorrect manner. Outside of the hazardous universal waste are the used oil management standards. So used oil that's designated for recycling is not classified as a hazardous waste. There are specific standards for oil generators, collection centers, and different aggregation points. But ultimately, you as a generator of used oil can transport up to 55 gallons to a collection center. So I'm thinking of used oil that's coming from, say, a emergency generator, a vehicle, maybe even used oil that's coming out of a oil bath from a laboratory. Things that we're not expecting the oil to be contaminated with any other hazardous chemicals. If you do have oil that's contaminated with other halogenated solvents, then we would need to take a sample and make sure that it meets the specifications where that can be used for oil or energy recovery. All right, we'll move to our next section and we'll talk about medical and infectious waste. Essentially, we have the regulations that are on a state level. So I do have the Texas rules listed here. If you're in another state, you most likely have either your state health department or state environmental agency that's issued some type of rule that defines and outlines how medical waste will be managed. If we move to a more federal level, we could look at some of the bloodborne pathogen standards, but typically these apply to preventing sharps injuries. So that's a requirement for sharps containers, as well as different marking and labeling requirements. And if we're looking at laboratory activities, we may go back to the BMBL and look at our different laboratory and clinical practices and look at their definition of infectious agents. So essentially, in managing infectious waste, we're going to make the identification, make sure that we have it packaged in an appropriate manner. It does have to be labeled. There are requirements for labeling. We're going to store that in a secure area and then ultimately either treat that on site or ship it off site for treatment prior to disposal. And then just like with chemical hazardous waste, we do need to incorporate some emergency response activities into our plans and then keep our manifest or our other reports for a certain period of time. So typically, what is an infectious waste? We typically think of that as waste that's capable of producing an infectious disease. So number one, we have to have a presence of a pathogen. It has to be virulent. We're going to have enough dose, some type of portal of entry. And then in addition to these three factors, there's also the resistance of the host. That can vary by age, by sex. There's all sorts of variations in that. Infectious waste includes what we call isolation waste. And for many of us, that might be someone that comes in and is complaining of a certain illness, and everything that they take off or materials that are used to treat them would just be considered as infectious waste. We also have microbiological waste from research laboratories. There's a designation here that says that's a bio level 2, 3, or 4. It's just left as microbiological waste. Bulk human blood, and that means greater than 100 milliliters free flowing liquid. That also applies to saturated disposable products, but this is not dry Band-Aids. This is free flowing liquid. Infectious animal carcasses, body parts, or bedding, and that's animals that have been intentionally exposed to human pathogens. Pathological waste fits into this definition. That would be tissue samples from humans. And then, of course, we have sharps. So as far as packaging, we're looking for something that's rigid, leak-proof, that can be sealed and moisture resistant. If we do have any liquids that we're adding to the package, we need to make sure that we add absorbents. Our bag needs to meet some standard to prevent bursting. Our container needs to be labeled according to the bloodborne pathogen standard. If we're creating aerosols, then we need to make sure we can close the container. I typically recommend the containers with the foot activated lid. And then any sharps need to go into an approved hard wall plastic container. So the pictures I have here are typical containers that would be used for shipping medical waste offsite for disposal. The key here, according to DOT, is that red inner liner is tied in a single overhand knot. Some of our typical sharps containers, for syringes and needles, we want to use something like the red container in the middle. If we have glass from the laboratory that's been broken, but it's non-infectious, then that glass can go into a cardboard box that's labeled as broken glass. And then for any patient exam rooms or publicly accessible areas, we would want to use sharps containers that have some type of enclosure that prevents theft. Once we've collected that waste and it's in our storage area, we need to make sure that it's secure from theft, that it's secure from the elements so it's not getting wet. We're not generating any noxious odors, and we're not attracting animals. It needs to be posted with the biohazard symbol. And then as a good management technique, we want to make sure that we have some type of spill equipment available. This might be something as simple as a broom and a dustpan, or maybe some other remote equipment for picking up sharp items. As far as labeling on these shipping containers, they're required to have the words medical waste. Here in Texas, it's required to be twice in English, twice in Spanish. The red bag uses the inner packaging, do not require labeling. And as I mentioned, that liner must be tied in a single knot. For shipping these materials off-site, the off-site shipments require that the name and address of the generator is included, as well as the date of the shipment. And typically that's achieved by using the vendor's supplied label. As far as treatment and disposal, medical or biological waste must be rendered non-infectious prior to being disposed. This can be done off-site or on-site, utilizing one of the approved methods by the state. Typically, that's something like autoclaving, maybe a chemical treatment and maceration. Dry heat is another approved method, as well as incineration. Most common that we would have on site would be autoclaving. For shipping this off-site, we want to make sure that we've vetted the medical waste transporter and disposal facility. They're probably going to use some combination of incineration or steam sterilization, and then they should be returning these special waste manifests to you. A key note here is that they should be returning the manifest within at least 30 days, and that you should keep those records for at least 3 years. So I mentioned the on-site treatment. what's typically done on site would be some form of steam sterilization through an autoclave, possibly incineration. It's not very typical that chemical disinfection or thermal inactivation would be done kind of on a widespread basis. So I have a picture of an autoclave here that can be used for medical waste. What this is typically doing is raising the temperature to, sorry about that, raising the temperature to at least 250 degrees for 30 minutes. Once you've achieved that, it's considered sterilized, and then it's typically disposed of as regular trash. In Texas, there is an on-site notification requirement, and that notification is made to the TCEQ for anyone that's generating more than 50 pounds. Typically includes your contact information and then an outline of how that waste is treated. One of the requirements is to perform some type of quality control. We achieve this by using.
Alan, hang in there. I know you've been talking a lot this morning already before this. If you need me to step in, just let me know.
No, it's all right. I think I just needed to get a little water. But we're using the efficacy monitors. And we perform these on a basis that essentially relates to how much waste is treated in the area. It's important to document the waste treatment processes, and we do accomplish this by using the autoclave logs. So we include the name and initials, the date the waste is treated, the amount of waste, the type, and then we also include the conditions. So that that's the minimum 250 degrees for at least 30 minutes. Just some examples of documents that we use to record the efficacy monitoring results. And then finally, if we're doing liquids, we need to make sure that we're using an EPA registered disinfectant and that we're providing sufficient contact on. Hey, Scott, if you want to just chime in for the rest of the biological.
No problem.
We're just about done.
Yeah, no problem. Sorry about that, Alan. I know you had a presentation before this as well. So EPA registered disinfectant, I think, is key here. Hopefully within your program, you have some of these things specified, whether it's a 10% bleach solution, 70% isopropanol or ethanol solution, or some other EPA registered product. I think that's important. For those of you who are paying attention during the COVID-19 pandemic, the EPA does come out with specific lists of chemical disinfectants that are appropriate for different organisms. So if you have something that's very specific in terms of the organism that you're working with, you're going to want to look at the product label and make sure that EPA registered disinfectant is appropriate for the organism. So for example, during the pandemic, the EPA put out a so-called List N as in Nancy, of chemicals that they verified were effective against SARS-CoV-2 virus. And then you want to look at the chemical manufacturer's specifications in terms of concentrations and recommended contact time as well. Alan, can you proceed on the next slide?
Oh, sure.
All right.
So essentially, it was just talking about the contingency planning. Basically, that it needs to be written and address any of our cleanup procedures, what types of chemical disinfectants would be utilized, and where we would dispose of that waste. These plans don't have to be their own standalone documents. They can be incorporated. So really with this, this is the material that I kind of intended to show during the presentation, we can go into the radiation waste management. Essentially, in this, we're talking about some of the common waste streams, which are solids, liquids, and vials, and then how we would manage any of these mixed different waste streams. The disposal process is generally follows the scheme that the waste is segregated by the researchers, collected from individual labs, and then ultimately disposed of utilizing some of the available methods. Scott, I don't know if my voice is going to make it through this one, so I think
No problem.
This may be the asynchronous portion as well.
Alan, thank you so much. Sorry about that. Why don't we go ahead and pause here? We're up against the end of the course for this week, at least anyways. This is probably a good time to go through a couple of the questions that have already been posted, and then we can open it up for any other questions that might have, you guys might still have. So Andrea asked earlier on about examples of different hazardous wastes that we deal with. I think Alan touched upon this throughout the presentation in terms of chemical wastes, biological wastes, and radiological wastes. You know, we've seen a huge decline in terms of overall radiological wastes. We have much fewer radioisotopes being used in our research setting. So that's a good news, especially those that are longer lived. In regards to biological waste, we have both laboratory activities that involve biological agents and materials coming from humans and non-human primates that we need to manage as biological waste. We also have our clinical activities across our clinical spectrum. And then in terms of chemical waste, we have various different processes, both in the research and the clinical settings that chemical wastes are being generated. The largest volumes of chemical waste for us coming from our Department of Pathology. So a lot of alcohols and xylenes represent a huge percentage of our overall chemical waste stream. So Andrea, I don't know if that answers your question or if Alan answered more of that question along the presentation, but I'm happy to loop back to that if you would like more information. Ben Yang had asked about do you encourage labs to quench cyanide salts with potassium permanganate before disposal? So, Alan, I'll let you respond to this one. I don't know if we do too much of this here.
I would have to do a little further research, maybe with Will Bryan. So that may be something I can get back to him with next week.
I tell you what, we will do some more research, and we'll actually we'll post it to the Canvas site, and we can also talk about this at the beginning of the session next week. But I agree with Alan. We don't do too much of this here, but we can get you an answer on some good best practices. And then one last question was, are the dates required to match? And I don't recall when that question was issued, and it looked like Juliana stepped out of the presentation. So I apologize that I don't recall the context for when the question was asked there. Are there any other questions or discussion points for the three topics that we covered today: chemical safety, occupational health programs, or the hazardous waste management section? Corbin, I see you have your hand up there. Go ahead. He says accident, sorry. Carrie just chimed in, are there standards by which SDSs are written? The answer to that is yes. The Global Harmonized System has basically standardized the 16-section format that safety data sheets are put together. So if you look at any safety data sheet that is modern, meaning after the Global Harmonized System came into effect, then you should see that standardized 16-section format that is familiar between any safety data sheet. Okay, well, I've got 12:55 Central Standard Time. That's 5 minutes left in the course. If you guys want to keep talking, we're more than happy to continue the conversation here. Otherwise, feel free to sign off, and we will see you next week. Keep in mind that there is asynchronous content for the chemical safety portion of the presentations that we went over today, as well as the hazardous waste and environmental program that Alan covered. So you can go to the Canvas site and find those asynchronous presentations as you go through them. If you have questions, discussion items, please post them throughout the week on the Canvas site. And then Will Bryan and Alan, and we're going to try to get Dr. Perkison here back again next week as well. But the first 15 minutes we can dedicate to discussing these topics, inclusive of the asynchronous content that you're going through throughout this week. We'll see you back here 1 week from today at 9 a.m. next Monday, Central Standard Time. Guys, thank you so much. Hope you guys enjoyed today's session. Have a great rest of your week. And I'll be very interested to see how our national championship basketball game goes across the street tonight. Be safe, everybody.
Great. Thank you, Scott.